everybody, and welcome to the Board of County Commissioners meeting for May 5th, 2020. I have a few housekeeping items to state first, and then our agenda will first be the joint meeting of the Board of Health and Board of County Commissioners, and then we'll move into our regular board meeting for the county commissioners. So here is a few housekeeping items for those that have tuned in. The public watching this meeting, when you're registered to watch this meeting, you're registered in our system as attendees. Attendees are webinar participants who are simply viewers of the meeting, an audience member. Your microphone and your webcam are automatically muted as attendees. However, there will be a time during the meeting that we will open it up for public comment. When that time comes, if you wish to participate in public comment, I'll ask you to raise your virtual hand to be recognized. You should see a hand icon on the device you're using to watch the meeting. You will simply press the hand icon once to raise your hand. When public comment begins, our meeting organizer will call names. When your name is called, you'll be unmuted and will be given 3 minutes for public comment. When your 3 minutes is up, you will go back into muted status and the next name will be called. You can then continue to watch the webinar as long as you choose. We will try to give everyone who wishes to present public comment an opportunity to speak, but please note, in the event there are more people wishing to speak than the time allots, I might need to limit the number of speakers, reduce the time of each speaker, or randomly select participants to participate in public comment. We haven't had to do that so far, so hopefully there'll be time for everybody to be able to speak. With that, we'll move into our joint meeting of the Board of Health and the Board of County Commissioners. Are there any adjustments to the agenda for this meeting from anybody? Seeing none, is there any emergency business? Seeing none, we'll move into County Council item 3A, ratify Board of Commissioners recession of the second reading and public hearing of Ordinance 20-03 in the matter of amending Lane County Code Chapter 9. Lane County lodgers must accept government vouchers or payments during an emergency. Violators subject to penalties, sunset clause declaring an emergency. For this particular item, the regular Board of Commissioners voted to rescind this item at last Tuesday's meeting. And this is simply a ratification of this particular item and potential ordinance. At this time, I would entertain a motion for approval.
I'll move approval.
Second.
Okay, moved by Commissioner Sorensen, second by Commissioner Burney. Any discussion? Commissioner Farr. And then I'll do Commissioner Sorensen.
Thank you, Chair Buck. I just have a question. I'm voting, of course, in favor of this. We've already more or less ratified it. But in the state's requirements for relaxing restrictions, one of them that each sector, counties must have hotel rooms available for people who test positive. Can somebody reaffirm that after we pass this ordinance, we will still comply with having hotel rooms ready according to the governor's instructions?
Chair Buck, Commissioner Farr, I'm happy to answer that question to the extent that I can. I noticed that same requirement in the information.
Karen, would you just introduce yourself?
Sorry, I forgot that not everyone who might be watching knows me. Thank you for that. Karen Gaffney. My regular job is as director of our County Health and Human Services Department, and I'm currently serving as our incident commander in our Emergency Operations Center. So,
can you spell your name, please?
Can you when you're not speaking, that would be helpful.
I also noticed that in the prerequisites list that the governor released on Friday, she included that on her list. We, as you probably all know, we have a meeting with the governor's office this afternoon where I expect we can get some more clarity about what each of those measures means. Aside from that, what I can tell you is we do have some hotel rooms in Lane County. Some of our rural communities were willing to step forward and offer some resources. So we do have some limited hotel rooms. And then I believe that we can pretty persuasively make the argument to the governor's office that the tiny homes that Sponsors has offered, as well as eventually our River Avenue when it comes online, will meet the intention that she has in making sure we have opportunities for people to be able to isolate and quarantine if they need to.
Thank you, Karen. That was the question. That was the answer I expected and hoped for.
Commissioner Sorensen, we can't see you, but if you'd like to speak.
Just to let you know, thank you, Chair Buck. I just want to let you know that I can see all of you, and my computer says that you can see me, but I can't see myself. So I just wanted to say that I'll do what I can to try to work on the technology here, but there's some limitations for me. I'll try not to insert myself into the discussions without some kind of warning. Regarding this matter, I have really two questions. One is, in the event that that we get into this situation again, maybe during the so-called second wave of the infection, do we have was this kind of approach, that is that we could force, they must accept the government vouchers? Has that been tested in other places, or was that an idea unique to Lane County, as opposed to buying a motel and thereby having a motel available, as opposed to forcing people to accept vouchers? Could someone comment on that? Because if we do get into a situation down the road where we do have an explosion in infections, we may need to do something like this. And I think the legal component of it should be worked out before we face that possibility. So could someone comment on that?
Chair Buck, I'm happy to start, and I will, I'll defer to County Counsel for the legal part of that question. What I will say is that I know there's significant interest at the state level. As Commissioner Farr mentioned, the governor has pointed out a requirement for hotels to be part of the plan, and indicated that if there were communities who needed assistance with that, that the state would offer to help. I don't know exactly what that means from the governor's office perspective, but my sense is that there will continue to be efforts statewide to form partnerships so that communities are able to respond to any increase in disease that may come. So I know that that's in the works, and again, I will defer to County Counsel on the legal question.
Okay, Steve Dingle, are you there too?
Yes, I am. Chair Buck, Commissioner Sorensen, I am aware of at least two other Oregon jurisdictions, Multnomah County and Clackamas County, that have adopted or taken similar, I think they've actually adopted ordinances. They have not been tested in court, and I don't have to tell you as an attorney that it has been the subject of some, pretty hot debate back and forth whether or not it's subject to being challenged as unconstitutional. But that issue has not, to my knowledge, been decided by a court in Oregon.
Okay, and thank you very much. I think that the key thing there is that we need to continue to be vigilant about learning whether these types of forcing lodgers to accept government vouchers.
Chair Buck, Commissioner Sorensen, that is absolutely the conversation we intend to engage in with the governor's office as we move forward with our request to be able to reopen Lane County. As I mentioned, she only released that list on Friday, and we do have a call scheduled with her this afternoon, and I imagine this will be one of the issues that gets worked out between now and when the county is able to submit our actual formal request.
Okay, and then the other thing is that meeting, Mr. Dingle, is that a board meeting? The meeting with the governor where the 5 commissioners are participating this afternoon at 4 o'clock?
We were actually going to have that conversation under county council announcements because it is not a designated board meeting for us. And we may need to choose who can attend that particular meeting.
I guess we could also extend our board meeting since we happen to be meeting today anyway.
We're unable to do that due to the virtual meeting requirements.
Oh, okay, good. All right, I don't have anything further on this, and I would urge a yes vote.
Any other discussion? I may just add, if you don't mind, I'll just add this real quick, and then Commissioner Burney, that the Bureau of Labor and Industries, BOLI, is interested in this particular item. They have been doing investigations in other counties that also see lodgers not willing to house people in this manner. And so from my perspective, it's not really a county policy issue, but more of a labor issue. There have been some articles out, and I know that BOLI is watching this particular issue internally and trying to work with the hotel and lodging industry. Commissioner Burney.
Well, if BOLI is watching, just a hello to Val Hoyle. Sorry. Let me just give you some perceptions here. One, I want to articulate clearly for those watching what we are voting on and expect to approve is we are taking off the table any requirement of private hoteliers as it relates to accepting government vouchers or payments during an emergency. That's what we're doing. Personally, rather than now trying to talk about all the legalities of if this happens again, et cetera, let's also reiterate, underlying this, is actions this Board of Commissioners has taken to help ensure we're not in this position again as it relates to the old Veterans Clinic off River Road, number one. Number two, I think sometimes when you have a crisis or it's a stress test of sorts. And what we have learned is not one of our hotels stepped up. Well, that's not true. The solution to this was not the result of a hotel stepping up, but there were, I understand, several hoteliers that in fact did offer services, and we just needed to work out the mechanics of how we could access and operate that. So rather than, for me, spending scarce energy figuring out how we force people to do things if we need them to do that in the future, right now we start developing relationships and partnerships and mechanics so that if in fact this need ever arose again, and it's far less likely because of our real estate purchase, that we have those relationships in place and we never have to resort to telling people, private businesses, what they have to do because we're just not getting the resource we need for public health. So that's my statement, and I am enthusiastically voting yes on this motion.
Any other discussion? Seeing none, we'll call for a vote. All those in favor, say aye.
Aye.
All those opposed, say nay. Motion passes unanimously. And that is our only item under our joint meeting with Board of Health and Board of County Commissioners. So I will adjourn that particular meeting. And we will begin our Tuesday, May 5th, 2020 meeting of the regular Board of County Commissioners. Are there any adjustments to the agenda? I do have one. We were just going to move item 6B in front of item 6A so that Dr. Ludke has time to get to another appointment. Are there any other adjustments to the agenda? Seeing none, do we have any emergency business?
I'm sorry, it took me a while to get unmuted here. I just wanted to mention or ask you when we're going to take up the matter of the governor's phone call.
That's under County Council announcements, item 8A.
Okay, thank you so much.
Any emergency business? Seeing none, we'll move on to public comment. And I will ask our moderator to take over that particular item.
Thank you, Chair Buck. At this time, anyone who has registered for the meeting and would like to participate in public comment, please raise your virtual hand so we can determine how many people we have for public comment. Giving everyone a chance to take a moment and raise their hand. I see about 7 or 8 people right now with their hands up. Our first person I will take is Dave Stauffer. Dave, I will start the timer and unmute you, and you may begin your public comment. 1 moment. Dave, you may begin your public comment.
And open up the economy. We need to go back to work. It's too great a disruption of our life and the way we make our money and earn our livelihoods in Oregon for us to continue shutting down the whole economy. Scientifically speaking, we all live with the fact that we could die at any time and that we will certainly die at some point. We have to be brave and just continue to live life even under those circumstances. A common saying is that good health is just dying at the slowest rate possible. Many of us will eventually die because of an infection, a virus in our lungs that will make us unable to breathe. That will happen hopefully when we're very old and in a nursing home. But that's one of the very common ways that people die. Or other things that the COVID-19 virus infects, like hearts and kidneys and lungs, cause people to die anyway. Prior to the COVID-19 viral infection, 30 to 40,000 Americans passed away every year due to flu infections. Different flu infections that changed every year. That has not changed, nor will it. The COVID-19 viral infection is another strain of flu that is killing elderly Americans. We did not shut down all our restaurants and bars in past years. We just accepted the fact that thousands of people will get the flu and die while the rest of us continue to live and earn our livelihood. At the beginning of COVID-19, we didn't know much about it. We didn't have a cure for it, and we didn't have a vaccination for it. Now we have a number of cures. Remdesivir has been shown to be effective. There's a vaccine in England that has been shown to be effective in treating COVID-19 in monkeys. I'm a candidate for Secretary of State, and I appreciate the opportunity to address this body. And I think that we can all be brave and get through this. We need to open up the economy. Thank you.
Thank you for your public comment. Our next presenter or speaker will be Laurie Harbor. I apologize if I said your name incorrectly. I will start the timer and unmute you. 1 moment. You may begin your public comment.
Oh, can you hear me?
Yes.
Okay, thank you. So first, I'd like to thank all of you, commissioners, for the incredible work and dedication during this time and how hard you're working to address the needs of the county and everyone in the county. What I want to talk about today is the situation with renters and what likely could ensue if we don't take more active measures to protect low-income renters once this emergency is lifted. As Kevin shared oh, you know what? I'm sorry. I should explain. I'm wearing two hats for this, a board member of CETA and also a staff attorney at Lane County Legal Aid. As Kevin Cronin shared last week during his testimony, over 31,000 renters in Lane County were struggling to cover their housing costs prior to this pandemic. And another data point that's relevant to this is the mean hourly wage in Lane County, which is only $12.97. Yet the mean hourly wage needed to afford a 2-bedroom apartment in Lane County is $17.10. So given the high cost burden before this downturn among what presumably is around 31,000 people, as we know, the vast majority do not have a cushion to cover rent that's in arrears and are at serious risk of homelessness. And then the other data point is based upon the unemployment filings, the highest number of filings are from occupation sectors that earn below the 1710 needed. Food services and retail trade, to name a few. And then just looking at the national level, the data shows that the #1 reason for eviction is non-payment of rent. And along with that, studies have shown that the majority of evicted renters end up homeless. And so this is a real concern. And going back to the TAC report, we know that the costs that cities and counties incur for people who are unhoused are far greater than keeping people in housing. So moving on, on behalf of CETA, we urge you as commissioners to seriously consider a range of solutions to avoid what could become an incredibly costly crisis in the months ahead. And thank you. I know last week you agreed to a work session to explore the possibility of emergency funding to fill whatever.
Thank you for your public comment. Your 3 minutes has expired.
Okay, thank you.
Thank you. We will now move to Kim Fairbairn. I think I pronounced that correctly. I will start the timer and then unmute you. Give me 1 moment. I apologize, there's a delay in my button pushing here. Ms. Fairbairn, you may start your public comment.
Oh, okay, thank you. Hi, my name is Kim Fairbairn. My husband and I own Max's Tavern in Eugene, Oregon. We're one of the campus area businesses. Gosh, I would sure appreciate it if people could actually seem to be paying attention to me when I'm talking. Feels like you're all on your phones or doing something else. Anyway, so yeah, the longer this goes on, thank you. I appreciate that. So I have a couple of concerns. One is that I feel that this, obviously we're greatly affected by this shutdown. We've laid off 24 employees. The longer this goes on, those jobs are disappearing. I will guarantee you. And I've also been told now that even when we do reopen at half capacity, I'll have to shut down by 10 p.m. Most of our business occurs after 10 p.m. So you are literally taking a business that we're thriving and had 24 well-paid part-time employees doing a great job. We will have maybe 2 when this returns, if at all, the longer this goes on. And I don't understand the justification for a 10 p.m. shutdown, I think a virus could spread just as easily after 10 as it could between 2. The other thing I wanted to bring up is that you seem to think there is social distancing going on, but there is not. In the campus area, there are droves of students having house parties, walking the neighborhood, talking to us at our doorway. I go to Home Depot, I brush by 20 people a day. I go to the grocery store, I brush by 20 people a day. So, and I'm not the only one that feels this way, but this shutdown feels motivated by something else when I don't believe that actual social distancing is occurring. I think people cannot continue this. I have 2 veterans that work for me. They literally have had 2 friends that committed suicide this week. So this lockdown is becoming desperate for some of us small business owners. I think you are on the verge of seeing some pretty, and crime. I wanted to talk about crime. Soraya had a rock through its window. I had a bike lock cut. I've had massive amounts of graffiti. And I'm starting to feel like I need to sleep at my business overnight to protect it. So we really, truly do need to reopen. We can do it safely. You need to trust us. We are not dumb. People can work together on this. Thank you for your time.
Thank you for your public comment. Our next presenter will be Adam Burdell. Mr. Burdell, if you give me 1 moment to start the other timer, I will unmute you. 1 moment. Mr. Burdell, you are unmuted. Look. There you are.
Thank you so much. Good morning, commissioners and staff. Thank you again for all of the just incredible work you are doing during this season. It's really inspiring to see the way you put public safety and public health first, and we're so grateful for that. My name's Adam Burdell. I'm the pastor at the First United Methodist Church of Eugene. During the colder season, we serve as the Egan Hypothermia Shelter for homeless youth. And of course, we're now starting to do the interesting work of determining what it might look like to reopen for public worship in some gradual way. We don't imagine that starting until July, but would welcome conversation with the county about their expectations for how to do that well and how to continue to put public safety first. I attended the commissioners' online meeting a couple of weeks ago when staff expressed a hope that an emergency shelter for homeless youth could open as soon as Wednesday, April 22nd. I wanted to make sure commissioners were aware that, of course, as of today, May 5th, no emergency respite shelter for youth has been able to open. And I struggle to come up with another circumstance where we would divide up our homeless population and say we're going to serve this group and not this group. For example, we wouldn't open up a shelter that isn't wheelchair accessible and say, well, we just aren't able to serve homeless people in wheelchairs. Sorry, it's the best we can do. We wouldn't say, well, the churches in the nonprofit community, they can deal with homeless people who need wheelchairs. They got this. We wouldn't do that. And that's what we've done. We've taken a whole cross-section of our homeless population, the more than 500 homeless youth enrolled in Springfield, Bethel, and 4J public schools. The county has said that that group of vulnerable children doesn't need emergency services during a public health crisis. Now, of course, county staff are doing incredible and good work right now in lots of ways. I'm grateful for that. We are all grateful for that. But we need to learn and act on the lessons from this season. We've been asking for help for months. Our nonprofit community lacks the capacity to do an emergency youth shelter in a public health emergency. And if COVID-19 resurfaces in the fall and the fairground reopens as a respite site for the homeless, now is the time to hear a commitment to include respite for homeless youth in that planning for future public health emergencies. We'd be so grateful to hear that commitment. And we'll continue to work to try to get a youth site open. Please keep us in your prayers, knowing that you remain in ours.
Thank you for your public comment. Our next speaker will be Nicole De Graaff. Ms. De Graaff, give me 1 moment to get the timer set up, and when you hear me say go, you will be unmuted and ready to speak. 1 moment. One moment, I apologize, there's delays on my end. Ms. De Graaff, you may begin speaking.
Can you hear me? Okay. So my name's Nicole De Graaff, and a few of you have received a few emails from me over the last few weeks. And I just want to thank Commissioner Sorensen and Bucks, and also Commissioner Farr for being on Rick Dancer last night. It's helpful to hear from you guys. And so, you know, my emails might be urgent in that I seem impatient looking for answers. It's only because since Governor Brown has been coming out saying we're going to reopen at some point, there's been no clear direction. And I'll tell you what, one thing we can all agree on, this is affecting us all in different ways, but I think we would all like some kind of measurable timeline or a little bit of hope, some light at the end of the tunnel. But I won't go into what I sent yesterday. I'd already given my public comments, but I just want to ask on page 12 of your blueprint for reopening Lane County. On page 12, it's down toward the bottom. It says the county intends to defer to the governor's guidance and executive orders for employers, the public, as well as for specific sectors. This will help provide clarity and limit confusion for the community as we all work together to carefully reopen Lane County. So my question is, and maybe it'll be addressed later on when this is gone over, but if that's the case, does that mean Lane County does not have their own blueprint for bars and restaurants and playgrounds and churches and small business to open? And the other thing I would like to mention is if there's anything you can do to get those awful billboards out of town, the one that says teenagers are dying of COVID, my kids can read that and it's really upsetting and it's unnecessary. So I know that we don't all know what's going on behind closed doors. We're not privy to the phone conversations and meetings you're having with the governor, but I would just urge you that a lot of us might not seem patient. It's because we're kind of desperate, and I'm getting a lot of calls from people, and we just would like a clear time frame. And it's sad we've lost 7 weeks that we cannot get back, and I understand the nature of it. But I'm probably, just take me on the other end of the spectrum of really wanting to open. So I might want to be more aggressive than other people. So I just wanted to really ask you to keep in mind churches. This is a time where people really need to be ministered to, and it's really hard to happen when we can't do it even in person or even see that churches is on the plan. Thank you.
Thank you for your public comment. Our next speaker is Sven Berg. Sven? Give me one moment to change the timer, and I will tell you to go when your time begins. One moment. You have been unmuted and you may begin your public comment.
Thank you. Hello, this is Sven Berg. My family has a local ski shop, Berg Ski Shop here. And first off, I want to say thank you to everyone here to taking care of the Lane County, taking care of City of Eugene. Really appreciate you guys doing your best to keep people safe and keep people informed. You know, that has been difficult at times. I want to thank Commissioner Pat Farr for doing Rick Dancer last night. That's the only way I found out about this. That was a huge thing for us to actually be able to interact and educate other people, including myself, on what's going on. My big thing was testing. When are we going to see proper testing? I'm pretty sure I've had COVID-19, but I wasn't allowed to get tested over and over and over. I literally tried 5 times to get tested to keep from infecting my family, my wife, my customers. And now I need to do an antibody test to see if I can still work, which leads to Berg Ski Shop. We are shut down because we believe no dollar's worth a life. We want to keep people safe and we want to keep ourselves safe. And so that leads back to the testing. We need to get our employees tested. We need to get myself tested. We need to get our customers tested. When can that happen? And then when we go to the second half of opening, it's already cost us a lot to be closed. It's rough. But we do want to follow the rules. And so when it comes back to reopening, we're going to have to do modifications. We're going to have to give our employees PPE. Is there going to be any type of way to help us local businesses to acquire PPE for staff, for maybe even having a stack of masks at our front door when people walk in going, oh, you don't have a mask? Take one of ours. Is there going to be a Costco solution to acquire these products so we can have it in our store to help everyone who wants to walk in our door? Past that, that's my two questions. Thank you very, very much, everyone, for doing what you do.
Thank you for your public comment. At this time, I do not show that anyone else has raised their hand for public comment. If you would like to speak to public comment, please raise your virtual hand and I will call on you. I will give you 1 moment to do that if you would still like to speak. And I am not seeing anyone else raise their hand, so Chair Buck, I believe this concludes our public comment.
Thank you, everybody who was able to give public comment. We will move on to response and remonstrance from the commissioners. Is there anybody wishing to speak? Commissioner Farr.
Thank you, Chair Buck. Two things very quickly. One to Ms. Fairbairn, the owner of Max's. I want to reassure her that I, for one, and I believe all of us were paying attention to you. As I was looking away from the screen, I was typing pretty much every single word you said, which I often use quotes when I speak a little bit later. You had a couple of good things to say that are going to be a part of my response a little bit later on in this meeting. I appreciate your comments this morning. A couple of folks had mentioned that I was on Rick Dancer last night. He has a Facebook show. And on that show, I gave a link to this meeting today and a link to the agenda for this meeting today. I think that's what people were referring to. Thank you.
For interacting with them. Yeah. And just.
Any other remonstrance? Commissioner Bozovich.
I just asked.
Thank you. Thank you. I'll also remind folks that if they want to interact with a commissioner, I do a weekly internet radio show Wednesdays at 4 o'clock live. It has a call-in feature called the Bo's Nose Show. Easy to find on my Facebook page, Jay Bozovich, West Lane County Commissioner. So every Wednesday for an hour or more, I can take phone calls from folks and answer questions. And I usually talk about what the board's done the day before and what we're planning to do and various other county issues. So
testing and PPE.
Just a little reminder there, you don't have to watch Rick Dancer and hope one of us comes on. You can see me every week.
Say what's going on.
So beyond that, I just want to, for Laurie and the folks at CETA, our senators basically announced yesterday that 5.7 million in rent assistance is coming to Oregon from the federal government through grants. So hopefully that'll get distributed, and hopefully our governor will start distributing the federal money that's already come to Oregon. It's supposed to come down to cities and counties that she has not distributed yet. So we'll see as that money gets distributed, whether it gets, how well that helps some of that issue with renters. I think one of the things that's going to be most helpful with renters is paying attention to folks like Kim and Sven, and getting people back to work so they can actually, so they're not building up an even larger liability in unpaid rent. The sooner they're back to work, the less back rent they'll have to pay. And we just have to work on doing that carefully. And the question that Nicole had about page 12, we have another item coming up on the board agenda, which is a letter to the governor asking for some ability to make, have local control to make exceptions to her recommendations relative to business opening that are specific to local conditions. And in addition to that, also to make, for us to have local control to take quick action if things start going the wrong direction also. That's coming up on our agenda a little bit later. Thank you.
Madam
Bernie,
Chair, when you get a chance, can you call on me?
I'll do Commissioner Bernie, and then after that, Commissioner Sorensen. And just a friendly reminder, if you're not speaking, to make sure that you're on mute, whether you're on the phone or a presenter.
Thank you, Chair. Thank you, everyone that presented. A rejoinder. I felt terrible when we were all reprimanded to not pay attention. And I also was typing notes, and the way this cubicle called my home office operates, it's impossible not to do it. But I do apologize. There was no disrespect at all. There's so much that's been mentioned, and I can't possibly respond to all of it, but I would like to say a few things. One, this body did not set in place all of the measures under stay at home, et cetera, and closed business. And as Commissioner Bozovich mentioned, we're going to be looking at ways in which we can request waivers, exceptions, local circumstances, et cetera, to a blueprint that has yet to be activated, that we will learn more about this afternoon. We are as frustrated as anyone. But that's not quite true. Having been a small business owner, I couldn't be as frustrated as someone that is watching their dream and livelihood that they've invested their heart and soul in lose business the way this is. In a meeting with commissioners across the state and the governor, I proposed something which didn't go anywhere, but my proposal was, especially for the restaurant industry, when you combine the fact that food banks across this country, including our own, don't have the money, resources, or food to get to all people who are hungry during this crisis, that I used to be in ag business, and it breaks my heart that ag businesses are plowing crops asunder, and milk producers are pouring millions of gallons of milk down the drain because with restaurants closed, there's no market. So my question was very simple. Why can't we just pay every restaurant in our state $10 a meal to deliver meals to those that need food in coordination with whomever? I would imagine here, Food for Lane County. Because those workers, it keeps local workers working. It keeps food chains operative. It maintains what can be maintained without any additional risks. And I only point that out not because I think, that's the be all and end all, but I point it out because I agree. We for mental health, for livelihood health, for personal health, we need to start reopening life as we knew it, but we have to do it in a methodical and safe way. I really agree with the comments that, once there are basic premises, social distancing, how we clean things after people, individual business, nonprofit, community entities can figure out the most effective way to do that for themselves. And finally, today, this Board of Commissioners is going to be tackling that subject. What is the governor proposing? We're going to hear from the governor later. What degree does home rule enable us to intervene on behalf of businesses? So I appreciate all of that. I also want to make one statement in terms of, I think it was Nicole De Graaff, but I'm not sure, who said that they have teenagers at home and they don't need to see placards amping the problem. That's just a comment on our society. I don't like all the social media amping problems or amping emotions. Emotions are high as it is. Teen suicide is high. The numbers we're getting on suicides, on sexual and domestic abuse right now, on various ways in which frustration is exhibiting itself. Everybody is frustrated and emotional. So I thank the presenters. We're on it to the degree we can be. We're all doing our best, as are you, and I thank you so much. And I look forward to the rest of the meeting. Thank you, Chair.
Commissioner Sorensen.
Thank you very much. I'm sorry that I can't see what angle this camera's on, but thank you for giving us an opportunity for this remonstrance. Well, first of all, Ms. Fairbairn, I just want to mention that I did hear you, and I am a patron of your business for a long time ago, so thanks for your running that business. It really, to me, is heartbreaking when I hear the stories of business owners. Commissioner Burney mentioned, what it's like to put your heart and soul into a business. I've done that. Took a business from, 0 employees to 7, and it was pretty demanding at times to make things go. So your business, roughly 3 times larger, to me, that is just quite an accomplishment that you've kept it going. And what a heartbreak to see the impact of this disease and the subsequent economic fallout. And also, thanks for bringing the human condition into this discussion, because I don't have any data to support this view, but I think that your comment that you're aware of suicides taking place among people who have tried to in some way participate in society, and then life gets so difficult that suicide seems a better option than living. And that, can you imagine how low you have to be before that's true? So I just, I think that this is having a huge impact on people whose life savings have gone away, or their businesses have gone away, or they've lost their jobs, or they were trying to get a job and they see no prospect of that. So the human sacrifice or human suffering is huge. Mr. Berg, thank you so much for your public comment as well, because all of us are available. I've taken phone calls at midnight. I've taken phone calls at 6 a.m. Our email is quite busy. I, of course, try to focus on the people that live in my district, but your business is in my district, and I'll just say that we're all available to respond to questions. And I think you ask really great questions. Are we going to be proactive? Are we going to figure out a way to provide those masks, or are we going to give you a straight answer and say we just don't have the money and that's not within our wheelhouse? Right now, I would certainly encourage you to talk to our economic development folks to see if that is something that they are doing or recommending. So far, I don't think it has been, but I don't really know. And Ms. Harbor with CETA, the board has directed that we have a work session on the concept of an emergency rent fund. And I'm really looking forward to that and seeing what the board's ideas are. And Commissioner Bozovich points out that there are federal funds that were passed along to the state for this purpose. And I certainly welcome your perspective in terms of an email to the board or more public comment on how to appropriately spend that money. And last but not least, I think that we are seeing increased projections for a longer term of this current wave of coronavirus. And I just encourage the public and commissioners and staff to look at that University of Washington Center for Health Metrics view of what is going to happen. Certainly, countries like Sweden or states like Georgia that have chosen a more relaxed approach, they're getting a much longer period of time, and countries like New Zealand or states like Oregon are having a much lower per capita infection and death rate. So, and then last but not least, I'll just say that I'm hoping that Karen or someone from Health and Human Services can comment on the need for the preparation for the second wave of this disease, and whether or not second wave is something to be planned for, something to be scoffed at, something to be feared and planned for. I just really think that we can't be avoiding the downstream. In our planning, it has to be more than week to week. It has to be further ahead. And the concept of a second wave is something that I think we need to be well aware of before we make too many changes. Thank you.
Commissioner Burney.
Thanks very much. Just one point on Mr. Berg's testimony. I could not agree more. And in today's Register Guard, there was even an article. I'm going to quote a couple of quotes from it to reiterate how significant this is. Oregon was declared by the White House Coronavirus Task Force to be among 4 states with the lowest testing capacity in the United States. It goes on to state that the state's capacity for testing is about 3,000 per day, according to OHA, Oregon Health Authority, but only about 1,200 per day are being conducted. At our last or one of our more recent commissioner meetings, we were told by staff that they were shooting for 500 a day just in Lane County. Testing, much less antibody testing, is the only way that from the health perspective, we're going to be able to quarantine those that need to be quarantined, because the vast majority of us do not. But we can't shoot in the dark, and yet we need to have this to open up this economy fully. So I just want to reiterate, Mr. Berg, I hear you loud and clear, and we're all pushing for it. Thank you, sir. Thank you, Chair.
Commissioner Farr.
Chair Buck, I only want to say this, that I appreciate your method of chairing meetings where you allow for other commissioners to speak once, even twice, before you make your comments. I'm anxiously awaiting yours. Thank you.
Well, thank you for that. I do appreciate everybody who's been speaking at public comment, and I wish we still could have our evening public comment sessions, and hopefully we'll be able to start those soon when we're opening up in general. I look forward to our discussion here in a bit that hopefully will answer several of the questions that were brought up during our public comment period when we hear from Dr. Ludke and Ms. Gaffney about our blueprint for opening back up. I think there's a lot of really wonderful information in there, but it's not perfect, and nor is the guidance that we seem to be trying to work off of, and it continues to change and be updated every day, if not multiple times during the day, as has been the practice since this whole thing began. A lot of really important points were brought up. I have been hearing from a lot of people about opening up their businesses and trying to get people back to work. You know, as a small business owner myself, I completely understand the urgency. And some businesses have been hit harder than others. And so COVID not only strikes inequitably between people, but also the nature of business in our community. So with that, I just want to say thank you to our speakers. And we have one more speaker, Joshua Caraco, hopefully I pronounced your last name properly, that I wanted to get in here before we move on to the next item.
Mr. Caraco, I have unmuted you and I am starting the timer. You may begin your public comment.
Yes, thank you so much. And thank you, Chair Buck. You did pronounce my name correctly. I run the hotline at the Springfield Eugene Tenant Association. And I appreciate your comments again that this crisis is not affecting people equally. We need to stop saying it's a great equalizer. The lowest, I've created a graphic I will share, and some people have seen it already. But the lowest paid sectors of the economy are hurt the hardest, and simply reopening businesses will not solve the problem that all the workers in those industries make wages that make it impossible for them to collect savings. So that's just not alone an option. And I do appreciate all the hard work we're doing in the public health response here, and that is the most important thing. If as restaurant workers go back to work, restaurants are occupied at lower capacity, they will see lower wages. CETA has come up with some solutions that the county can do. They are based on things that other counties have already done, that other states have already done. Some of them are grace periods, 6-month grace period. Once the governor's residential eviction moratorium is no longer in effect, residential tenants unable to pay a portion of their rent or utilities should be given a grace period in order to avoid mass eviction. Tenants will need time to pay. No security deposits or rent increases should be allowed during this period. I appreciate the rent assistance. I really do at all levels of government. All experts say that the amounts coming from the federal government and the state government could not possibly cover the gaps. And we must remember that the most vulnerable people, and many who work in industries like the restaurant industry and retail, are immigrants and others who may not be eligible for these. We also continue to get calls from students who want to get out of their lease agreements and are threatened with actual damages. And we are saddling our youngest generations with debt. And there are things we can do for debt and credit protection for everyone. Unpaid rent does not have to be treated as enforceable debt under the law. We could protect people's credit. This includes attempts to collect through a collection agency, reporting to a credit bureau, or pursuing judicial action. So there are things that can be done at the county level to somewhat mitigate the damages here. And this is backed up by all available data. And we will share these comments with you. And I just want to say, as someone who worked as a baker and pastry cook before I did tenants work, I'm very aware of many sides of this issue. Thank you for your time.
Thank you for your public comment.
Yes. Thank you, all of you that spoke. We have all your issues on the top of our minds and appreciate your time. With that, we'll move on to item 5 on our agenda. Is there a motion to approve our consent calendar?
So moved.
I'll second that.
Okay, moved by Commissioner Burney, seconded by Commissioner Farr. Any discussion? All those in favor, please say aye.
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 All those opposed, say nay. Motion passes unanimously. With that, we'll move on to item 6B. We changed the order of A and B to accommodate some people's schedules. So we'll start with 6B, Order 20-05-05-01, in the matter of opening up Oregon, Lane County, including approval of certification of sufficient PPE for first responders and delegating authority to the county administrator to sign any certification documents. With us is Ms. Gaffney, Director of our Health and Human Services, and Dr. Ludke, our Public Health Officer. Please start when you're ready.
Chair Buck, commissioners, I'm actually going to turn it over to Dr. Ludke to go through this presentation. I know he has limited time with us this morning and needs to be on at another meeting by 11. So I'm just going to let him take it away.
Thank you, Karen, Commissioner Buck, and the commissioners. I am working with the technology right now with my assistant, and I know she has been listening in that the sound is ahead of the video, so I think our viewers have a bit of a delay. So are we ready, Danielle?
Yes.
I think we are.
So in order to go forward, you just click your mouse like that.
Very good.
And then, yes, there you go.
All right. Commissioner Buck, am I able to be heard? If so, I'm ready to go. Great, thank you so much. So I appreciate the opportunity to speak about our blueprint for reopening here at Lane County. As you know, we've had a series of 7 criteria that we have been watching for many weeks, actually several months now, to make sure that we're watching the right parts of our dashboard to see if we're moving in the right direction. And I'm going to start with the governor's draft roadmap and then proceed to how it integrates with our reopening plans here in Lane County. So as I mentioned, here's the governor's draft roadmap. I'm sure that many of viewers have seen it, but certainly the commissioners have seen it. It begins with gating criteria, which essentially is, are we ready overall? So in the symptom area, are we seeing fewer respiratory-like illnesses over the last 2 weeks? Are we seeing fewer COVID-like diagnoses over the last 2 weeks? Then we move to cases. Are we seeing fewer actual confirmed COVID cases, meaning laboratory test result that says it was indeed a COVID infection? And for the hospitals, are our hospitals able to deal with a surge? Are they able to treat everyone who is coming to them and not resort to crisis care, which typically is a lesser standard of care when there is a large crisis? Then we move into the core state preparedness. Is the system ready for us to relax restrictions? Do we have enough testing and contact tracing, people who are able to identify cases that may be incubating in our community? Is the healthcare system capacity able to move forward? And do we have plans for a variety of critical areas? Plans for high-risk facilities such as long-term care and jails, plans for mass transit, plans for critical industries. And then once we pass those two criteria, the system being ready and the overall state being ready, then we move into this phased approach. And the governor's first phase is that over 14 days, we will expand to allow, for example, mass gatherings to include up to 10 people and such. And then phase 2 is up to 50, and phase 3 is larger sizes. So that's a very brief overview of the roadmap for the governor. And then I'm going to proceed to our 7 criteria. So here they are. First, do we have falling cases over the last 14 days? 14 days is chosen because the incubation period for this virus is up to 14 days. The vast majority of people who become infected, in roughly days 4 to 6, they become symptomatic after they're infected. But some people have a delay. Maybe they have a weaker immune system, maybe they have a stronger immune system, and they don't become symptomatic until day 12, 13, 14. So that is the incubation period. And we want to make sure over the length of an incubation period that those cases are declining. Number 2, testing and availability. We really want to make sure that we have enough testing and some testing locally. We want sufficient contact tracing, and I'm going to speak about each of these more in detail in the next few slides. Do we have overall plans for a second wave, as was alluded to by a couple of the commissioners? We don't think this virus is going to go away quickly like a light switch turned off. We think it's going to linger for some time, so we need to be prepared. Do we have sufficient PPE, personal protective equipment, the blueprint for restriction relaxation for all of those items I mentioned before, critical industry, mass transit, high-risk facilities, et cetera? And then finally, are we integrated? Are we collaborating with others? Because it would be one thing to be the lucky county that had no cases and full ability to respond to any if we got a second wave, but we're surrounded by other counties that have a good deal of disease. We need to make sure that we are aware of that regional issue. So taking each one separately, falling cases over 14 days, this is the graph of the actual cases we've had confirmed so far in Lane County. The blue line shows each of those cumulatively, so adding up. And you can see on the x-axis or horizontally, those are the dates, starting with our very first symptomatic case on March 1st, and then cumulative cases on the left and individual cases on the right. So the blue line shows you that there was a point in time where we were pretty steep. We had a steep curve. We were gaining infections at a high rate, and we were concerned. And right about that time, in the 3rd week of March, there was the governor's stay-at-home order and the other requirements. And we saw a fairly quick decrease in the steepness of that curve and then a plateauing beginning about the middle of April around, well, what used to be called tax time on April 15th, but not this year. So then the purple, hoping it's purple on your screen, sometimes we don't have the colors translate well, but the individual boxes below are individual cases, and you use the right-hand side of case counts per day to read each of those. So you can see, again, with the steep part of the curve in blue, we had more individual cases during that time period. So we have seen, indeed, as you look to the right-hand part of this graph, either the blue line plateauing a bit, and the purple lines or purple boxes showing fewer cases. So we are, while we wish we had no cases, we are in a much better place than we were 4 to 6 weeks ago. So we're feeling better about that. Moving on next to testing and availability, early on in this, if you recall, late February, the State Public Health Laboratory up in the Portland area began doing COVID testing. They were the only laboratory in the entire state that did this test. And they stayed that way for several weeks. And then 2 large commercial laboratories that we contract with here in Lane County quite readily with a number of our practices and hospitals, Quest and LabCorp, began testing, one on a Friday and one the following Monday. And they ramped up testing. All of their testing is done out of state, but they serviced many of our clinics and urgent cares and hospitals. They ramped up their testing, and then within another week or two, 2 other clinical commercial laboratories began doing testing. One is Legacy, and one is Interpath. And neither one of those were doing their testing in the state of Oregon, but they were offering tests to us. So within a short period of time, not short enough for many, we had some testing availability, but we had no testing done in the county of Lane. We had samples collected, and they were all sent out of state or to the state laboratory. And that was until about 3 weeks ago, when Peace Health Laboratories started testing here locally. And shortly after that, McKenzie-Willamette Hospital started testing locally. So now we have roughly 500 a day with some ability to stretch to several hundred more a day at those 2 facilities. And that's a wonderful addition to our armamentarium, as we used to say in my Navy years. It is the ability not only to have rapid turnaround time, a sample not being sent down to a California lab and the turnaround time is 5, 6, 8 days, but it also allows us to...
Did you mean 50 a day, not 500? Because your report says 50 a day.
Their ability is 500 a day. Our request to them, to each hospital, is to give us, public health, 50 a day.
Thank you. Sorry for the interruption.
That's okay. Sorry if that wasn't clear. So I appreciate that. Clarity is important. So the ability to test locally is really important to us. And we now, with that commitment, and thanks for the nudge, Commissioner Bosevich, we have that commitment from the 2 hospitals to do that local testing. If we have an outbreak in a long-term care facility, or let's say in the jail, or some other congregate setting where these things can spread like wildfire, as we've seen in other parts of our country, we have the commitment that we can get samples to those local testing facilities and essentially not just be another on-ramp to an already plugged superhighway of testing. We have a local on-ramp and we can get that testing done right here, which is really nice. So we're feeling better about number 2. Moving on to number 3, contact tracing. On the left-hand side talks about what we're doing internally at public health. And this is absolutely nothing new. Each of you, the county commissioners, know very well the work that we've done in this space for many, many years. Last fall, we had a measles case. And even though we only had a single measles case, that measles case went to 4 local businesses, had all sorts of contacts, flew in on a plane with others with measles. A single case means hundreds of contact tracings, lots of phone calls, lots of liaisons, building a relationship, making sure people are aware of their risk and making sure we're protecting the community. And we do contact tracing, as an example, with measles last fall. If you remember in 2018, we had whooping cough, hundreds of cases. We had some school classes that were decimated. Lots of contact tracing with those hundreds of cases. I could probably go on, but the meningitis outbreak at the university in 2015, months of contact tracing. The year before that, we had really altruistic healthcare providers in our county who went to serve the Ebola outbreak in Western Africa, and they came back to our county, and we had to monitor them every day, doing fever watch twice a day for 21 days, and if they had any contacts, do contact tracing. That went on for months. So this is nothing new. We do a lot of contact tracing, and this is very much akin to what we're doing now with COVID. We have a team led by a nurse and a disease investigation specialist, or DIS, and they go out, sometimes on foot, what we call shoe leather epidemiology, burning a hole in your shoes, or they make phone calls and they contact these people and make sure that they're aware of their diagnosis or their potential for risk, and then recommend testing, etc. We have upgraded or upscaled that to include other persons we pulled within our department and liaisoning with others who could offer us some contact tracing, such as the University of Oregon. And then, of course, the governor has mentioned that she is going to support a large increase in contact tracers throughout the state, and there will be an opportunity for us, should we get a big second wave, to utilize those resources. On the right side of this screen is the hospital work and the hospital needs. Our hospitals have been working with us in public health, but also they've been working together. It's really quite heartening to see the chief medical officer for Peace Health Hospital and the chief medical officer for McKenzie call each other by their nicknames and work hard together and say, okay, how are you doing for ventilators? What's your stretch capacity? If you're going to upscale, where you're going to do it, well, you have tents in your parking lot, et cetera. That is actively going on, and we're confident they have the ability to increase 20% for a wave. The ventilators, we have a bit over 120 ventilators in our county, which meets our needs currently, and we have surge plans working with the hospitals to make sure if things get terrible, we can get some more. And then finally, the response plans with our partners, if we do get that second wave, how are we going to work together? We feel that we're in a pretty good place for that. So next is PPE. I think you've heard a great deal about PPE. We're in a much better place than we were a couple months ago. But that being said, the county has really served in a wonderful capacity for the provider community. We have given out tens of thousands of pieces of PPE to hospitals and to long-term care facilities and clinics and urgent care. And that's gowns and gloves, face shields, masks. We've given out swabs so they can test people with the nasopharyngeal swab. We've given out hand sanitizer. We've given out a lot of things from the pipeline that we've had and from the pipeline that we've been able to replenish through ordering, and some through FEMA and some through the governor. So we're in a better place now. If we did have a massive outbreak, if we had an outbreak like, say, New York City or Milan, Italy, we would be stressed too, and we'd need to refill that pipeline quickly. But again, 2 months on, we're much better than we were back in, say, February. The blueprint and OHA support, as I alluded to earlier, it's important for us to not think that we are exceptional in Lane County and that we could open up and yet be surrounded by a lot of other disease and not suffer any potential harm. So we need to liaison with our other counties. We need to liaison with the state. And as you know, later today, we'll have a conversation around regions 3 and 5, the hospital regions 3 and 5. And the public health officers from those 6 counties have been talking a great deal. In fact, Sunday night, we had a 2-hour meeting to talk about how we're all going to work together as part of this regional vision of the burden of disease and how we can help each other if one site runs out of swabs or runs out of testing capacity. So that liaison work has been working quite well. So those are the 7 criteria. I'm going to stop there and happy to take any questions along with Karen Gaffney. Thank you.
Any questions for our presenter?
I have a question when you were going to call on me.
Commissioner Sorensen.
Thank you. Thank you, Dr. Lucky, for this presentation. Really excellent. I have a question about this so-called second wave that you mentioned. When is the second wave going to hit? Will that be in the fall or before? And if we do open the county up slightly as a result of this conversation with the governor's office and any amendment to the executive order or the plan we submit if it's approved, how will that dovetail with the idea that some people believe, and I think you should tell us whether that's a good belief or not, or a good observation, whether we're going to see a second wave. I'm a big fan of both the Johns Hopkins University website as well as the University of Washington website, and they don't really go out that far in terms of projections. So they're projecting that we will have a decline in deaths per day in the United States, in Oregon, and in most places, even the places that haven't been as strict, such as Georgia or Sweden, and even those jurisdictions in New York that's been hit hard, they will all be going down. And so when is this so-called second wave going to be hitting if it's not even being predicted by reputable sources?
Chair Buck, Commissioner Sorensen, happy to entertain that question. So I'm not convinced in any way that my crystal ball is any clearer than anyone else's. But what I can say is when you look at the coronavirus family, especially the subfamily of beta coronaviruses, so there's 4 families of coronaviruses. The COVID-19 virus is in the beta family, or subfamily, and that subfamily causes the common cold. We have 2 coronaviruses that circulate every year. Each of us have had multiple colds from that virus. And we've had immunity for a short period of time, and then we got reinfected by that same darn virus, 1, 2, 3 years later. Those viruses typically show up in their highest force, their highest number of cases in the late fall. And there's really no reason to think that COVID-19 is not going to do the same. I can't predict when that will be. I'd like to say it's going to be October 15th, but of course, my crystal ball is not that good. But I think that betting against the fact that when we're all back inside, breathing the same air, close to each other, the risks increase. And when you look at those high-density communities that had devastating COVID-19 outbreaks, like Wuhan, China, 11 million people, New York City, 8 million people, Milan, Italy, the second most populous city in Italy, 3 million people. Part of that is density. Part of it is we all breathe and we all are at risk for it, but part of it as well is density. So when we get back inside in the fall and we're breathing the same air and the virus really likes the temperature and humidity of that time of year, the risks will increase. So that's one caveat. The other caveat is, in my mind and in the mind of many medical epidemiologists, every outbreak is a race, and it's a subset really of many races. In this particular outbreak, there's a race to get a vaccine. There's also a race to get more antiviral medications. There's a race for those asymptomatic infections to build up immunity and get herd immunity. So there's a race to herd immunity. So between now and the fall or early winter, we're hoping that we somehow get more herd immunity. It would be nice to get herd immunity by a vaccine, but the vaccine isn't coming anytime soon. So some of those asymptomatic infections that are out there are actually building us a little bit of cushion of health. So that's probably a long answer to your question, but it's very good for us to plan for a second wave with the first thought that it'll be late fall, early winter, and start to make sure that our hospitals and our testing and our PPE are ready for a big increase, with it most likely happening in late fall, early winter.
Commissioner Farr.
Thank you, Chair Buck. Dr. Ludke, one thing that you said, I disagree with you on. You say that your crystal ball is no clearer than anybody else's. Each time you speak, it seems a little clearer to me. So you are at least able to talk about what's in your crystal ball a little bit more precisely and clearly than anybody else. So thank you for that. I do believe we're very fortunate to have Dr. Ludke here in Lane County. I have a question regarding moving forward. Commissioner Bernie, you would talk about how you were in the ag business. We all talk about what we did in past vocations. I was in the Army, and we have a thing called the movement to contact in the Army. And that is where you take your unit and you know you're going to encounter the enemy as you move forward. In fact, you go to encounter the enemy. We're in a movement to contact right now. As we relax restrictions, we're in a movement to contact. And at some point, we are going to figuratively encounter the enemy, and the enemy will be firing at us with multiple weapons. My question, Dr. Lidke, is as we do encounter the virus, as we relax our restrictions, we'll be moving forward one step at a time in phases, 3 phases as described by the governor. As we encounter the enemy, what are we going to do to retreat? A part of the movement to contact is knowing your route back in case you have to go back very, very quickly. You don't have to make that decision when you encounter the enemy. You have to know what you're going to do. And you have to know what your rally point is going to be should you get separated. So, Dr. Luca, you were Navy. I was Army. We had similar missions. What is our retreat in case we do encounter superior forces or encounter opposition that we don't expect when we move forward with our relaxation?
Chair Buck, Commissioner Farr, I appreciate the question. I would, keeping perhaps with the military terminology, what is critical is situational awareness. That's a phrase the military uses all the time, and you really need to know what's going on the battlefield. So the first is to look at the indicators that we think are really important. And 2 of those are how much disease is there and how severe is the disease. So we look at volume, and as you probably recall, about 2.5 months ago, the public health officers and the state worked together to write up making COVID-19 mandatorily reportable and getting it up to the legislature and getting it approved. So it's mandatorily reportable. So any COVID-19 case has to be reported to public health. So we know the volume. So that's a good thing. A challenge with that, a little sub point here is we're growing the number of labs doing this work, so we have to keep reaching out to new labs saying, don't forget, in Oregon, you have to report to public health. And with these mail order labs and these sort of things that might be sent to another state, you swab yourself at home and you send them somewhere else, we have to make sure those results get reported to us too. So not just volume, that's the first part. The second part is disease severity. We really want to make sure that our hospitals are not overwhelmed. If you look at what happened in some of those cities, states, countries that their hospitals were overwhelmed, you don't just have deaths from COVID when your hospital fills with COVID. You're unable to take care of the other things that never stop. And that includes heart attacks and strokes and car accidents. And people died unnecessarily because their hospitals were totally full of COVID cases and they couldn't do these other types of procedures that normally we kind of take for granted, but they're important. So really, it's situational awareness, Commissioner Farr, and it's looking at those two pieces. And then once you get a signal that says, hey, something bad is happening, then you need to look at restriction re-implementation and saying we need to go back to social distancing and looking closely at what businesses perhaps would decrease the risk if we were to truncate their hours or close them or something akin to that.
That is a perfect answer. Thank you, Dr. Lepke.
Commissioner Burney.
Dr. Lepke, there were several, data, as you know, and forget the crystal ball stuff. Data doesn't interpret itself. It has to be interpreted. I appreciate your presentation and interpretation. You just said something. You said we know the volume. If we're not testing, how do we know the volume?
I think it's a good question. So a few months ago, we really didn't know the volume, and we really were limiting all testing to persons who were essentially critically ill. Their systems were failing and they were in the hospital. And over the course of the last 4 weeks or so, we've ramped up that testing significantly. And as you likely know, we have a 4 o'clock call with the provider community. We usually get about 100 people, 100 phone lines calling on. Oftentimes, some rooms have 10 people in the room, so we might get 200 doctors and nurses calling into our COVID call every day. And on that call, we are now promoting the fact that we have more testing capacity. We need to move out of the rationing mindset and test everyone who's symptomatic with a compatible illness that looks like COVID, and maybe even do select testing for high-risk individuals. So, Commissioner, your point is really well taken. We still have the opportunity to do more testing with the test capability we have, and hopefully in a couple months we'll have even more capability, and we will continue to do more testing of high-risk people and have a better ability to respond to those hotspots that we've seen in other jurisdictions.
Thank you. When you say we, are you going between we as the state of Oregon and we as Lane County?
Sir, mostly I'm saying we as public health and we as the clinical community. So we have come together.
In the country, in the state, in the county? I'm sorry.
In the county.
Okay. So here's my sort of $64,000 question. My understanding is that the federal Trump administration provided gating criteria and guidelines to governors, that our governor has taken those and is trying to put some meat around the skeleton. The name of your presentation is Prerequisites for Phased Reopening of Oregon. Are we ready to initiate phased reopening of Oregon? And what, from a medical perspective, should that look like?
So I think the last real piece, Commissioner, is looking at that, which actually is the first item of the 7, is over the course of 14 days, are the cases declining and the severity declining? And we have seen that for pretty good length of time, but on Friday we had 4 new cases. That's actually a pretty big day for us. Only one other day did we have 4, and then we only had 1 over the weekend. So we do need to watch this, and I think that if we stay on the same trajectory as we've been on for the last 10 to 14 days, by mid-May, we will have met that criteria that says we're ready to do phase 1. So I hope that answered your question. We're still a little bit in the waiting mode.
It did answer the question. So let me rephrase back to you. The answer is not yet, and unless data suggests otherwise, hoping for mid-May. Is that correct?
Yes, I would agree with that, Commissioner Burney.
Thank you, Doctor. Thank you, Chair.
Commissioner Bozievich.
Thank you. Dr. Lubke, if you could kind of go back to your two slides, the one that has the cases on it, number of cases on it, and then the testing slide. And I want to rock back between those two. As you can see, the testing has greatly increased over time. And then the actual positive cases per number of tests has dropped. If you can kind of going back and forth, we're actually seeing, like in the last couple of days, we've gotten several new cases, but that's based on testing at around 140 tests per day versus at the beginning when we were getting that many cases with less than 100 tests. A lot of these metrics around reopening are based on number of cases identified, and as we're swinging up towards 500 tests per day, does this metric around falling cases have any adjustment to the number of tests being run?
Chair and Commissioner Bozievich. So I think I need a nuanced answer to this. Well, first of all, the answer overall is yes, but the nuance is this. If we had unlimited testing in the time of a pandemic where there's no vaccine and there's no antivirals that are proven to work, you would want to test everyone essentially every incubation period. And you would test every 14 days, and as soon as you found a case, you would do contact tracing, find all the persons they contacted, and isolate the sick and quarantine the healthy, and you would stop the virus dead in its tracks. Well, that's the perfect way to move forward, and we nowhere near have testing capacity to do that. In fact, I can't imagine we would ever have the capacity to do that. It's a nice pie in the sky sort of view, but if you could imagine testing every Lane County citizen, 375,000 of us, every 14 days, we'd have to open many laboratories to make that happen. So absent that perfection, you have to look at what can you do with the resources that you have. So we have significantly increased the ability to test in terms of numbers, and we have been watching our positivity rate, the number of tests positive per number of tests ordered, slowly drop. It never got to double digits, but it was approaching 10% at one time, and now it's down to about 2%. In fact, it's even less than that recently. And that is, I think, the best we can do at present. We need to find people who are positive, do contact tracing and isolate them. And given the limitations in testing, we need to use the resources we have to test as many as we can to find them and then isolate and quarantine as those test results show. So that's a very nuanced answer. I think overall, my general answer is yes, but again, we're not living in a perfect situation in terms of lab testing capability.
All right, let me try and clarify my question. We have two metrics we're trying to follow for reopening in your guidance. One's falling cases over 14 days, which we've actually met pretty well. And then the other one's increased testing. And what I'm saying is we will probably never be able to keep the falling cases over 14 days as we're increasing testing if it's purely a case count that we're talking about. How are we adjusting that falling cases over 14 days if we're greatly expanding our test rate? Because it's well known that many people believe they've had COVID, including this story that was in Register Guard this morning, and could not get tested. So as we expand to 500 tests per day, we're going to find more positive cases. I mean, it's just statistics, pure statistics. That will blow our ability to show that we've had 14 days of falling cases. So our 7 pillars or whatever we're doing here is basically a plan to fail and never reopen. So is there some adjustment in these statistics for increasing number of cases based on increasing testing in the population? That's my problem is we're setting ourselves up to never reopen based on expanding testing capacity if we have to have falling cases for 14 days.
Chair Buck, Commissioner Bosevich. So for purposes of brevity and to fit everything on one slide, the first item simply says falling COVID cases over 14 days. If you look at the full blueprint, it's not just that. It includes not only the volume of cases, it includes the severity. So right now, for the first time in quite a while, we have 0 COVID patients in the hospital. So there's a severity issue as well. And then the other point I would make is that we do need to find every case. If we really want to stamp this out, if we really want to prevent widespread disease, we need to find each case and then do contact tracing and make sure they're not spreading it. And that's particularly true in those areas of congregate setting like jails and long-term care facilities. So I see your point. We're not going to go to 0. And I think drawing a little bit on Commissioner Sorensen's when's the second wave going to be, I'm hoping my reply to that didn't make people think we're not going to have any cases until the fall when the second wave might hit. We'll probably have fewer cases in the summer. It might drop to, we might have a whole week with 0 cases, and then we'll get 1 or 2 or 3, and then another 3, 5, 7 days with no cases. But there have been plenty of sites on this planet where it was their summertime, like Singapore back in January. They had lots of cases when it was hot and humid there. And we're going to have cases in the summertime. So, Commissioner Bosevich, I think your point is well taken. We're going to have some cases, but we're going to look at severity, and we're going to look to try to make sure that cases do not increase in large numbers by finding them and doing contact tracing.
Thank you. And I have some further questions about contact tracing and governor's recommendation and hospitalization for the plan that they put out for the 4 o'clock meeting. But I'll give a couple other commissioners a chance to speak and come back on the second round.
Commissioner Sorensen.
Thank you. It looks like my screen is back on, so nice to see all of you. With regard to the current testing, it seems like we went from 50 to 55 in 1 week. We've had a 10% increase in cases going up in Lane County. Is there a concept of a 3-day rolling average or a weekly or 2-week rolling average each day, so we can really, so that a statistic like that, where, you know, on Thursday we had 50, by Sunday we had 55, but on the other hand, you know, over the last 3 weeks, our rolling average really hasn't been that bad. So can you comment a little bit about how a county that is going up in cases, namely Lane County, where we've gone, and I don't think the public really has been told this, or at least understands it, that we've had a 10% increase in cases. Now, it's true we have 0 patients in ICU, 0 patients have died, 0 patients are in hospital. Those are all very positive numbers, but can you talk a little bit more about this concept of a rolling average that would, in fact, be a little bit more indicative of really what is going on?
And Dr. Pat, could you go back to that prior slide so that we can see the epi curve too? Because I think there's sometimes confusion in the public about date of symptom onset versus when the actual test result came back.
Yes, indeed. So thank you, Karen. Chair Buck, Commissioner Sorensen. So I was going to go back to this slide perhaps for a different reason, but it's nice to have the view of it. If you see underneath sort of the subtitle, the trajectory for cases when we were on the steep part of that curve was to double every 5 to 6 days. And then we had, in the 3rd week of March, the governor's order for social distancing, et cetera. And then we leveled the curve a bit, and then it's plateaued a bit. So one of the things that we do look at, Commissioner Sorensen, is we look at the doubling time. And we really want to make sure that cases doubling, you know, will decrease over time. That gets harder, of course, if you get out to hundreds and hundreds of cases. We also look at the steepness of that curve and to see where you are. Are you on the steep part of the curve? Are you on the plateau part of the curve? And then finally, yes, epidemiologists try to slice and dice the data in so many different ways. You look at a weekly running average, you look at every 10 days, you look at a month. We do all sorts of different ways to look at the data. And when it's early on in an outbreak with an organism you know very little about, you really don't know what is the best way to look at this? And it took about a month before we knew the incubation period, how long it takes from when you're infected to when you become symptomatic. There are other core epidemiological pieces of data. One is the reproduction number, how many new cases result from one case in a fully susceptible population. There's another interval called the serial interval. How many cases, what's the length of time between the first case and the second case? There's a variety of these numbers that we look at in infectious disease epidemiology. So a long answer to your question, Commissioner Sorensen, but yes, we do look at those. And perhaps as the numbers have gone higher and now we have a few months of this, a 7 to 10 day window with a graph would be helpful, and we'd be happy to put that together.
I was just going to say, I don't want to put more burden on you, Dr. Ludke. You were kind enough to call me on Sunday, and I then find out I told you don't call me on Sunday, spend time with your family, and then I heard you said you had a 2-hour meeting on Sunday on top of that. So I just feel like we need to be, as a board, we need to be respectful of the toll this is taking on our public health staff and how hard everyone is working. And so, no, you don't need to provide additional data to me on this topic. Thank you.
Any other comments or questions? If not, I'll go back to Commissioner, I'll go to Commissioner Bernie and then back to Commissioner Bozovich.
Commissioner, would you rather go first? It doesn't matter to me. Okay. What would make you happy, Doctor, to be able to open schools in September?
Chair Buck, Commissioner Bernie. So I still feel like we don't have enough testing capacity. So by way of a very recent example, on Saturday night, we were aware of a pastor in a local church who had several in his family that were sick, he and his wife and one of his kids. And interestingly, as life continues to happen for each of us, this particular pastor was getting a call to a new church in another state in the Midwest and was going to be moving this week, probably packing boxes right now. And public health was given a call. We wanted to get the 3 members of the family that were sick tested. And we have a good relationship between public health and Nova Health, where we can send patients to Nova Health. They swab the patients out in the parking lot, and then those samples get to Mackenzie-Willamette to be tested locally with a very quick turnaround time. And what happened was not a surprise to me that, unfortunately, Nova Health called me back and said, well, we only have 2 swabs left for the Mackenzie-Willamette testing. And where do you want me to send the 3rd one? Which will mean it'll be an out-of-state lab with a much longer turnaround time. So, I don't have a choice. None of the 33 health departments in Oregon have a laboratory. None of us do that testing. We're not going to bring that up anytime soon. It takes a lot of work to bring up a laboratory for really high complexity molecular testing. So we ended up sending 2 to Mackenzie. We got test results back within 24 hours, which is great. And the other one will probably be 4 or 5 days before the test result. So what I would like to see is continued increase in testing ability here locally. That really helps, again, not just with the ability to respond quickly, but the turnaround time for the test results is very short. So that would make me happier. And then we are working with 4J School District and a couple other school districts on how to keep the school facility safe. And I am not an expert in that footprint by any stretch of the imagination, but the broad issues of cleaning with EPA-approved products that actually are known to kill COVID, making sure that social distancing can be had in a reasonable way, preparing for those unpredictable events that we all know involves children. Children do things that you just can't predict. Those would make me happier and more satisfied that we could open up safely come school time in the fall.
Thank you. One of the sad things, bizarre things I heard was that with this coronavirus and closing of schools, this is the first time in 39 months there has been a month free of school shooting in the United States. One other question, and that is, I notice what is stated as needed for PPE, frontline health workers, of course, congregated facilities, of course. One of the inputs this morning we heard was from a business owner that asked, is there a solution for PPE for businesses when they reopen that want to maintain safe places. I'm calling that out. I'm not asking you to comment on it unless you would like to, but it just seems to me that there's a capacity thing here we need to be thinking about right now. And Dr. Ledke, I have heard so many stories of you working above and beyond. Thank you very much.
Chair Buck and Commissioner Burney, if I could just respond, because I know there are people who are watching this discussion who are planning their own reopening for businesses. So I did want to let people know that on our website, we're maintaining a list of places where people can go to start to rebuild their own supply chain around PPE. And so we are working to connect businesses in our community with those vendors, knowing that those supply chains had been disrupted earlier.
Thank you very much.
We do know that Dr. Ledke needs to get off to another meeting. So let's end with Commissioner Bozovich for questions or comments, and then we'll keep moving forward in our agenda for today.
Okay, two quick questions, and it's relative to the governor's proposal, and then a final question about PPE, which is what the actual board order that's in front of us is about. One, the governor's order is asking for declining prevalence of COVID, and it's talking about a 14-day decline in COVID-19 hospital admissions. We have 0 in the hospital right now in this county. So if we get 1 hospital admission, does that mean we're not going to be able to reopen?
Chair Buck, Commissioner Bozovich, no, it will not. I think using that rolling average phrase that Commissioner Sorensen was commenting on, we look at the totality of information. And what I really feel is important to note is the data points showing volume of disease is one bit of data. There's the data behind the data, famously called the metadata. So I'll give you an example. If we had 5 new cases today, and those 5 cases were all the result of transmission in a long-term care facility, we would not say that that is a criteria that will make us change our mind about, well, maybe May 15th, maybe May 22nd we could open. However, if we had 5 new cases, and after doing the contact tracing and the investigation, we found that 1 case was in Florence, and 1 case was in Deadwood, and 1 case was in Junction City, and 1 case was in Oak Ridge, and 1 case was in Creswell, and there was no epidemiological link between them. They didn't sing in the same choir together. They weren't taking a class at LCC together, any of those sort of things. That would be a different criteria. So I caution sometimes a single piece of data, people saying, oh, we can't open, we can't close, or this means A, B, or C, because there's a lot of data behind the data, and part of the contact tracing allows us to get the depth and breadth of that data to better interpret it. So a single new case in the hospital, we would not say all bets are off, we got to go 14 more days. We'd have to look at it over the course of several days and understand where that case came from, and was that case particularly susceptible? They were a 90-year-old person with leukemia whose immune system didn't work, etc.
Yeah, I'm just concerned that the governor's criteria is not flexible. So, which we'll get to flexibility later in the meeting. Second question, contact tracing. The governor's recommending 15 contact tracers per 100,000 population. That puts us well over 50 needed in Lane County, according to her metrics for reopening. And yet we show that we're only got 20 available right now. Is that a mismatch or something, or is the governor's recommendation including the surge capacity from OHA? Are you aware of that kind of conflict in numbers?
Chair Buck, Commissioner Bozovich, yes, indeed. So what I would say, and I would invite Karen and maybe even Jocelyn Warren, because we've all been talking about this, I would invite that sort of collaborative response, because we don't have a absolute definitive answer of how many people do we need. We feel like if we have 10 cases at a time, we can handle it. If we have 50 cases at a time, we can handle it. But if we get to 100, if we get a big second wave, we're going to need some help. So the criteria saying that Lane County needs close to 60 would really, to me, mean that we would have the ability to respond to a nasty second wave, really large number of cases. And of course, it's wise to plan to a worst case scenario. It's not always, we're not always readily able to have all the resources to be able to respond to that worst case scenario. But right now, and for a fair number of cases, we're doing fine drawing from people within the Department of Health and Human Services and training them and deputizing them to do this work. So there's a bit of a discrepancy. I think overall it's better to have more than fewer than you need. And if the governor is willing to send us so many, we're probably happily going to take them. But we feel like we're doing okay now, and we're pretty close to being able to handle a fairly bad second wave. But if it was terrible, we would be requesting some of those contact tracers from the governor's pot or governor's pool.
And Chair Buck and Commissioner Bozovich, I would just add to that piece that it really, in terms of our internal gating criteria, which clearly at some point we're going to have to mesh with the governors, we feel it's also important not only to look at population, but also things like the population density, which we know has an impact on likelihood of transmission, and those current case counts. It's interesting, on our website, we published the Oregon Health Authority map of cases per, can't remember if it's per 1,000 or per 100,000 that they have published. And the concentration of cases is significantly different from county to county. So again, as Dr. Ledke said, as of today, we only have 16 active cases. Those are the people who are sick at home, and feel like we have on hand right now sufficient resources to go up to 50 active cases. And the state has told us that they would help provide resources if we needed to augment that.
Thank you. I won't keep hammering on some of the reopening criteria. I'd just like to jump to the PPE question, because that's the actual board order that's in front of us to be approved. And I have a little bit of a question. This may bring in Mr. Dingle. I am greatly concerned that the governor's requirement to have board of commissioners approve the fact that we've got sufficient PPE for first responders is pushing liability from the state down to county commissioner level, where I am not an expert in first responders. I don't have any firemen that report directly to me. I have no idea personally that they have that available PPE, let alone whether the emergency room personnel at Peace Health have it, et cetera. And the governor is asking us to approve a board order certifying that we have sufficient PPE. Seems like it's just setting us up to be legally liable from some employee in the future that doesn't get PPE, that's a first responder, because we made this certification. So my question to Mr. Dingle is, are we liable if we approve this board order, or can we push back to the governor and say, you know what? I am going to depend on the fire chiefs to say they've got enough. I'm going to depend on the hospitals to say they have enough. They're the people and professionals that know. I don't. I'm an engineer by training and been I've been a commissioner for 10 years. None of that makes me an expert in PPE. And I don't want to be liable for some action that the governor put into some criteria that's kind of forcing liability down the chain rather than taking that responsibility at the state level. So, Mr. Dingle, can you kind of answer my question? Are we making ourselves liable if we approve this board order?
Well, I know less about PPE than you because I'm an attorney. So when I looked at the thing, and I guess maybe Dr. Ludke or Karen or Jocelyn, someone can clarify this. The first question is, what is sufficient? And I couldn't find a definition of sufficient. Is it sufficient for the needs we have today? Is it sufficient for whatever? So that was my first, in terms of what we're certifying, I couldn't find a specific standard that we are meeting. I'm reluctant to talk about liability in a public setting, but obviously anytime you have a governmental entity certifying that something is safe or that something exists or that something can be done, that always carries with it the risk of liability. From either, in this case, it would be either, the risk from employees, I guess, that there's a workers' compensation issue, but then again, you've got third-party claims that wouldn't be covered, like, for example, within the workers' comp thing, or just plain citizens.
Chair Buck and Commissioner Bozovich, again, I'll leave the legal piece to County Council. I will say the process we used in our blueprint, for the same reason you talked about, Commissioner, is to turn to the chair of the Fire Defense Board to do that certification, because the Fire Defense Board manages that for all of the jurisdictions in Lane County. And what he has done is turn to each of the districts to look at their 30-day burn rate and what they need to have on hand to anticipate covering a 30-day supply for PPE. And he is checking in with each of those districts weekly and certifying to us that they have at least a 30-day supply. And then again, I think part of why the state has asked the counties to take on this role is because under the statewide emergency management system, the county is the clearinghouse for PPE for everyone in the community. And so we are, all requests from first responders for PPE from the stockpile go through Lane County.
So I appreciate the answer of both legal counsel and Ms. Gaffney. My concern is, the fire folks, they only cover the fire side. Have we gone around to, say, City of Cottage Grove Police Department and asked them if they've got sufficient PPE, or Florence Police Department, Oak Ridge? There's so many different first responders in this county, and we're being asked to make this certification. It seems like the governor's trying to push something down onto us. And yes, we are the distributing point for the PPE, but having to certify that seems like just trying to have us have some kind of liability in this reopening phase that is unnecessary in some ways. At the same time, the governor hasn't distributed the federal funds down to the county levels that she's supposed to. So I'm kind of the opinion that this is an unnecessary risk in making this certification for the county. And we should ask the governor to reconsider requiring counties to make this certification and table this motion, table this board order. Because we'll be on the phone with, somebody will be on the phone, hopefully, with the governor this afternoon, and maybe that question can be asked. But I have great trepidation over certifying this and the financial risk it's putting the county at. All it takes is one family member of a first responder, and first responder is a broad definition. That can be everybody from an EMS guy in a fire department to an emergency room worker. And some family member gets COVID-19, passes away, and relatively young, and we get sued for their lifetime earnings. That's, we all know we've got some lawsuits similar to that we're dealing with right now. And it's tens of millions of dollars in that one particular lawsuit. And you can imagine what that's going to be like. So far, that's one of the things that's, as a business owner, I think, keeps me up at night is the whole risk around liability. If somebody in a business that's, family member or employee ends up with COVID-19, am I going to end up in a legal lawsuit later on because supposedly I might not have taken enough action to prevent a transmission or something like that, or they'll say the transmission happened through work. That's something hopefully that maybe Congress can deal with in some national tort claim law. But at the moment, we are wide open, and we're just adding to it by if we approve the certification and something happens that certification proves to be wrong.
Okay. Well, I appreciate the presentation of all of the things we need to do for our blueprint to get off to the governor. I'm personally looking forward to figuring out how to open up our community again and getting back to business and getting some work done and people feeding their families.
Chair Buck,
yes.
I'm sorry to interrupt. I just wanted to make sure that it's okay with you if Dr. Ludke leaves the conversation at this point, and he'll probably take his slides with him, but then we can continue to discuss the order that's in front of you.
Absolutely. Thank you, Dr. Ludke. Yeah, there's a lot of good information that we talked about this last hour over this. It was scheduled for about 45 minutes. We're a little bit over, but that's okay. It's an important issue for us to talk about. I personally feel from the information presented that we are in a very good position to get our blueprint finished up and off to the governor for approval. I know there's a lot of loose ends that hopefully we can wrap up in the next few days in order to send that off with additional information from the governor this afternoon, perhaps. But in my opinion, everything presented shows that Lane County is in pretty good shape given the circumstances. Regarding the issue of liability, you know, with the information provided through the EOC, if the EOC feels that we have what we need for now in order to process this order and in order to submit our blueprint, I trust their professional opinion. I will note though, if they come back and say, we're short, we don't have what we need now, that they come back to the board and say, we might need to alter our certification in the future. Should something change in our status of cases or an outbreak. If that happens, I feel comfortable with that. And I will be looking forward to, if there are new cases, whether they are related or somebody got in contact versus if they're in a outbreak, a new outbreak somewhere where nobody's had contact, as Dr. Ludke said. I think that really shows where we're seeing any new increase in our cases in Lane County and in the state. And hopefully we, as we open through these 3 stages, that we can do it in a way that we're very diligent about making sure our community is safe. With that, we have an order in front of us, and I would entertain a motion to approve order 20-05-05-01 as presented. I see Commissioner Sorensen's hands up.
I'll move approval, and if there's a second, I have a couple of questions.
Is there a second?
Second, and I will speak to the motion when I'm in the queue, Chair.
Okay. Motion made by Commissioner Sorensen and second by Commissioner Farr. We'll start with Commissioner Sorensen for discussion.
I wanted to know from Karen if, in her view, if the situation changes either for the worse or for the better, whether we can modify our plan, yes or no.
Chair Buck, Commissioner Sorensen, by modify our plan, do you mean could we place some restrictions in place in response to that?
Yeah, it says now, therefore, the Board of Commissioners orders, it is certified by a vote of the board, the governing body of Lane County, that PPA for first responders is sufficient. The county administrator is delegated authority any documents. Are we allowed to make any other changes once we have done this certification? What if it changes tomorrow and we want to certify that there isn't enough PPE? We become aware that staff or the fire board or the hospitals or whoever comes in and says, hey, I don't know what you were thinking. Maybe that was a good idea a week ago, but now we're just being hammered here.
Thank you. That clarification helps. I would say absolutely. My belief is that everyone at all levels of public health in the state knows that this continues to be an evolving situation. And as Dr. Ludke said, a piece of what's important in this is to maintain situational awareness. So if there's a significant shift in the situation, yes, absolutely. I believe that we would pause and pivot if we need to do that. And a piece of the second element of the board order in terms of delegating authority to the county administrator is really to enable us, if we do need to move quickly, that you have delegated authority to him to be able to do that. So yes, I think we're approaching this absolutely knowing that we're continuing to learn and respond.
Thank you.
Commissioner Farr.
Thank you, Chair Buck. And Commissioner Sorensen, thank you for that clarifying question. That was a part of my response. You know, I intend to, and I want to vote yes on this motion. I have a question for Mr. Dingle regarding something that you said. Item 1 and therefore is it's certified by a vote of the Lane County Board of Commissioners, the governing body of Lane County, that PPE for first responders is sufficient. You stated that you've not defined sufficient. So it seems like a pretty ambiguous order if we don't have an actual definition of sufficient. Can you speak to that, Mr. Dingle?
Sure, Commissioner Farr. I mean, that was my, when typically when you certify something, just in a very general sense, you're usually certifying it to some sort of standard. And that was, I understand what Dr. Ludke and Ms. Gaffney have said. That's nowhere in there. Like, it doesn't say adequate PPE for first responders at the current level of the outbreak or the outbreak as of whatever, or for 2 weeks or at the current level. That's all I'm saying is that it is, I'd like to say common sense prevails, but when it comes to litigation, that's not always the case. But it sounds like we have the flexibility to revoke. That's how I understand we say respond. I would say I would want absolute clarification from the governor that we could revoke our certification at any time, and that the board could delegate that authority to Mr. Mokrahajski. And we would simply say we no longer have the sufficient, we are no longer in a position to certify that we have sufficient PPE capacity for all first responders.
That is a pretty adequate answer, Mr. Dingle. I would like to vote yes on this, knowing that you are comfortable being able to defend it should we have to defend it at any particular level in court. One thing that Dr. Ludke said, and I wrote a quote that's very nearly a quote, is we're considering a blueprint which is by no means complete, nor is it perfect. New data is presented or discovered daily that force changes in our approach to relaxing social gathering and distancing restrictions. I think that what you have explained just now, both Ms. Gaffney and Mr. Dingle, that allows us to take a step back if we need to and reevaluate the board order that we're passing right now in order to declare that we perhaps are not in compliance with the board order, which says that PPE for first responders is sufficient. I'm going to vote yes on this and trust that Mr. Mokrahajski will keep an eye on it very closely and advise us should we need to make any adjustments to the order that we're passing today. Thank you.
If I could just follow up on one of those points, I personally would feel better, in addition to that ability to revoke, that it would be a simple matter for the state to agree and indemnify the counties for any claims brought against them based upon their certification that the governor is asking for. That would be a simple fix from the state.
And I suspect we would pursue such an indemnification subsequent to passing this order. Thanks.
Mr. Mokrahajski, you may have something to add to that particular question.
Thank you, Chair. And I just want to, I think it's clear that we're playing by the governor's rules, and the rules are a little murky at this point. And what we're trying to do, and why we're looking for action by the board today, even though the governor's final guidance is not out, is we want to be ready. As you heard from businesses, people want to open things up again. We want to be able to do that as quickly and as safely as possible. So I'm wondering if, and I guess I would ask Mr. Dingle if this would make sense, but if you can give some flexibility to me, not only to come back and make adjustments, but also in what we submit to the governor to say that, we're certifying that to the best of our knowledge, there is sufficient PPE as defined by what the governor has defined that as. And include any other sort of qualifying language that may help address some of these concerns that I think the board is legitimately raising right now about, we're sort of being put in the position, you're being put in the position of having to certify something without really clear guidance on exactly what that certification is. And so I think it would be fair for you to give us just a little bit of flexibility so that we can include language in what we submit to the governor that reflects your concern about, the liability related issues. I hope that's clear. And then certainly we'll come back and adjust and inform the board if there are concerns about PPE shortages in the future. But I also think just in this moment, having the ability to provide some qualifying language to the governor to say that, based on the kind of guidance and direction you've given us that is not totally clear, here's what we're certifying. That may be.
Sounds like a friendly amendment that we could possibly do. Commissioner Bose.
Thank you. So I'm the friendly, I think we're going to have a little bit better definition around what we're amending, because I'm really torn about this. I don't support the first therefore, but I do very support the second one that allows the administrator to sign documents to the governor for reopening. I'm also really torn because I'm not sure the governor even has the executive powers to require us to do this. I believe she's exceeded her executive authority under emergencies. She should have declared this emergency under Article 10A of the Oregon Constitution, which has a 30-day limitation on the emergency unless the legislature extends her powers. She's declared it under a couple ORSs, and the definitions of the emergencies under those ORSs don't fit the situation. And now she's extending the emergency powers that she has well beyond that. I think she's gone extra constitutional on this. So having to vote to fulfill requirements of something I feel is unconstitutional in the first place puts me in a bad situation. Then also having to vote on something that I feel uncomfortable on the litigation risk involved is also difficult. So I appreciate the administrator's attempts to try and maybe mitigate some of that. And I really, for me, it's really about reopening Lane County. I strongly feel we're in a position to start reopening Lane County. As I mentioned earlier, we have had a decline in cases over the last 14 days. We've had no one hospitalized right now. And with careful consideration for, sanitation and social distancing, I think a lot of our businesses can get back to work, and it's important for them to start getting there. And yes, it's possibly going to result in a few deaths down the road, but we all don't stop driving our cars, even though our bodies aren't designed to come to a stop at more than a couple miles an hour. Because, there's a lot of motor vehicle accident deaths in this county every year. And we do things to prevent that. We put in safety measures, we try and put out, education, we've talked about the 4 E's on that, but we don't stop people from driving because they might be a few more deaths in Lane County. We have to get the economy going again because there's a huge public health risk in not doing so. We heard about the renters earlier. We're hearing about other issues. Poverty causes bad health outcomes. And it's hard to keep a straight face as we have a little bit of Zoom bombing going along with Chair Buck. But yeah, for me, I am really in a difficult position. Do I vote? Do I even cast a vote for this, knowing that I believe we're answering an unconstitutional request from the governor? And then second to that, do I put the county in a position of additional liability based on an unreasonable and unconstitutional request from the governor? But I want to reopen Lane County. So do I go ahead and vote for this because it's going to hopefully maybe get us reopened? Because that's really the key here. We need to start reopening the county in a careful and planned way. And if it takes having to kowtow and meet unconstitutional requirements, it's a difficult place. I can't tell you if I'm going to vote yes or no right now, but I'll be interested to hear what amendments we can make that might lean me further towards yes.
Before I move on to the next person, I just want a reminder that we have an item later, which was going to be later, 9B, regarding the Justice Center update. And Judge Vogt will need to leave by noon. So if we can move through this, that would be good, so we can go straight to that item and have enough time to talk about it. Given the time that I see on the board right now, we'll probably move into the noon hour a little bit. Mr. Moker-Heisky, I think you had a response to that.
Well, hey, wait.
And then it will go straight to
I was going to offer some language if that's helpful, but I'll defer to Commissioner Burney if you had something you wanted to offer. I was going to offer language for a possible amendment.
Okay. Thank you. I appreciate that. I didn't mean to cause a minor panic over here. I learned something new, by the way, from a certified engineer. Now I know the human body is not meant to stop at beyond 2 miles per hour. I think that this ordinance, or this should have identify the methodology by which staff have asked us to certify that PPE is sufficient. It was talked through, it was shared with us, it's not on here. Number two, I think that we ought to identify it's sufficient as of this date, because we don't know what tomorrow looks like. And those are my 2 points. And thank you, Steve. I just wanted to make those points before you went on to any further wordsmithing. And then here's my other point. I think Commissioner Bozovich brings up fascinating issues. I mentioned this at another board meeting. We are seeing here from federal leadership to state leadership, responsibility for everything that goes good and no responsibility for anything that goes bad. Push that down. And I don't like that either. But I will say that with the couple of items that I mentioned, and Steve can take it over, I'm going to vote for this because I'm conflicted, but we need to reopen. We need to reopen smart. We need to reopen in a way that protects public health. And this is what has been dictated from on high we need to do to begin that process. So I think with the couple of modifications I made and whatever Mr. Moker-Heisky says, I'm going to approve something that looks like this motion. Thank you.
Mr. Moker-Heisky, and then we'll go to Commissioner Swanson.
So my suggestion would be in the first, now therefore, something to the effect of, it is certified by a vote of the Lane County Board of Commissioners, the governing body of Lane County, that based on the guidance and definition regarding sufficient PPE as provided by the governor of the state of Oregon, to the best of our knowledge, PPE for first responders is sufficient. So something to that effect. I think.
As of what date?
Well, you can say, I think it's as of the date of the adoption. of this. And you can say that if you want, but I think that gives you the ability to say, you know, based on the information that's been presented to you and based on the definition of what has been requested by the governor, to your knowledge, we have sufficient PPE available.
And Steve, this is Steve Dingle. The only improvement I would make on that is that that in good faith, the board, with the qualifications you mentioned, the board in good faith believes that at the current time that there is sufficient PPE.
Commissioner Sorensen.
Thank you very much. I just wanted to say that I think that the improvements are good in terms of they're good as of this date. The certification approval is good as of this date. And I think that that's reasonable for us to rely upon the staff in stating that there is sufficient PPE for first responders. We don't know what really is needed. We don't really know the broad definition of first responders, but we do know that staff has gone through a pretty good process of getting us this information. If we felt that the staff had not done a good job, I guess we could say, no, we don't think that there is sufficient PPE. I also think that that this suggestion that we kind of be aware that this could change in the future, I think that's good. In terms of the argument that if Lane County were to participate in this, we would be adding to the illegality or alleged illegality of the governor's actions. I don't really, I don't quite understand that. And if Mr. Dingle's on the line, maybe he could give his view of whether or not the governor's been acting illegally, and therefore we are in some fashion acting illegally by responding to an illegal executive order.
That wasn't my point, Pete. I wasn't saying.
I thought you said the governor. I thought you said the governor had
I think the governor is acting
illegal action.
I didn't think us responding was adding to it, making us complicit. If that was what you're trying to imply.
So we need to move forward with our meeting, and I am seeing that we have some consensus on the fact that we want to amend the language slightly with it looks like Mr. Mokrasky and Mr. Dingle's language. Is there a friendly amendment that we can attach or a restatement of the motion that we can make? Commissioner Farr.
Chair Buck, I accept it as a friendly with the provision that a couple of sentences that or clauses that Mr. Dingle and Mr. Mokrasky said, based on the guidance and definition as provided by the governor, and also the board in good faith believes. I think the rest of it can be wordsmithed.
I think that's acceptable to me too.
Okay. So we have a motion to approve Order 20-05-05-01 with the language that Commissioner Farr added. And there's one more discussion. Commissioner Bozovich.
Just real quick, I am going to vote in favor of this with those amendments because that relieves my issue about liability. And it's more important for me to get Lane County open than it is to fight about the governor's legality at this point. I'll play the game and try and get us reopened, so I will be supporting the motion.
I'm getting an ask for us to completely restate that change in full for the record. Mr. Mokrasky.
Well, I mean, I guess my feeling is we stated it. I stated the motion, the suggestion, Mr. Dingle added the in good faith, and we can take that language and I can work with Ms. Jones and Mr. Dingle, take that language, finalize it based on what the board's intent was, because I think it's pretty clear what we stated. So I'm comfortable with that.
Okay, looks like the rest of us are nodding our heads. We'll move to +1, Commissioner Farr says. So we'll move to a vote. All those in favor, please say aye.
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 All those opposed, say nay. Motion passes unanimously. With that, we are going to skip some other agenda items and move to item 9B, the discussion on the Justice Center update. We have some time limitations for some people, so we're going to move there, and then we'll move back to finish up our agenda, which will take us into the noon hour. Mr. Mokrzycki, you want to start us off?
Thank you, Chair Buck and Commissioners. We do have Presiding Judge Deb Vogt on the line, as well as our District Attorney Patty Perlow and our Sheriff Cliff Harold, who are here, as well as additional staff to respond to any questions you might have. I'm going to make some brief kind of overview comments, and then I'd like to ask if the presiding judge, the district attorney, and the sheriff have any comments that they would like to add to this, particularly given the time constraints that they have available today. So as the board knows, we've been working to replace the current Lane County Courthouse building since at least 2015. I started in Lane County in May of 2014, and I can tell you, I think it was on my second week that I had former presiding judge Kirsten Rasmussen and former Commissioner Faye Stewart and some staff in my office talking about the need to replace our existing courthouse that was built over 60 years ago. Of course, the board is familiar with the significant challenges around the safety, accessibility, the condition of the existing building, the lack of space, and many other challenges that we have that really create an inability for all of our residents to seek justice in Lane County. So we're familiar with those challenges. We have, for the past 6 years, 5 to 6 years at the very least, gone through a really aggressive process with numerous studies from the National Center for State Courts to DLR Group and our partnership with the City of Eugene to identify where properties should occur, the land exchange that has happened. So there's been a lot of work on this front. We've also known that although nearly half of the project cost would be covered by a state grant, thankfully through our work and advocacy with the legislature in the state of Oregon, nearly $90 million had been set aside for the planning and construction of a new Lane County courthouse. The remainder of the cost would need to be funded through local property taxes here in Lane County. Of course, COVID-19 has placed an unprecedented and unpredictable strain on everyone in our county, including our residents, our businesses, employers, employees, property tax payers. And none of us are in the position to assess the full impacts at this stage of COVID-19, although the board had a lengthy discussion earlier about wanting to reopen our local economy to get people back to work and businesses thriving again. And so you're clearly demonstrating your concern for our local businesses, for our local residents, to help people who are struggling. We still have really, none of us are in the position to clearly assess the national, regional, or local impacts on our economies, and in turn, our residents' financial positions. Given these challenges and the uncertain days that are ahead of us, we believe that it is in the county and the community's best interest to postpone the planning for a new justice center and a 2020 bond measure. As we'll talk more about later today when we launch our budget presentation for next fiscal year, Lane County has prided itself on its fiscal responsibility and its financial stewardship and long-term decision-making. And we, as difficult as this is, we simply do not feel that it's appropriate to ask our community to fund a large project in the context of all the other struggles that our community is facing related to COVID-19. I want to share with the board that you're aware, and we want the public to be aware, that before COVID-19, if you can put yourself in that place, that now seems really difficult to do, to think about the world before this pandemic occurred, we were in the process of refining the project. We'd identified ways to reduce the cost, and we had engaged stakeholders in ongoing conversations. We really wanted to listen to voters and taxpayers around where their concerns were knowing that any additional cost to taxpayers was going to have an impact and would be a burden. But we were trying to have the conversation about the value of the need and the value of this justice center in our community and our taxpayers' ability to pay for that. And so we had held several public input meetings and visited communities throughout Lane County to learn more about our residents' priorities. We were preparing for a large communication effort to describe the new proposal. All of these efforts will remain helpful when we resume our planning and continue working towards a justice center that serves the current and future needs of our community. And we will look for appropriate future opportunities to continue seeking to replace the current courthouse building, because the need, not only has the need not gone away, I think you'll hear the presiding judge and the sheriff and the DA articulate that the need has only grown. So there's certainly an understanding that the need is even greater than it was before. We're trying to act with fiscal responsibility, as we have in all of our actions, and be mindful of the impact on our residents. And we're still in the mode of learning, of trying to listen to residents and understand where can we improve this project and bring the cost in a way that is acceptable to residents and maintain the value and the impact on our justice system that is really critical. So we believe that, as difficult as this recommendation is for us to make to you, that it reflects the need for our justice center. It reflects an understanding that there still is a significant need for our justice center project in the future, but this is simply not the time for us to move forward given everything that has occurred. So I'll stop there, and that is just sort of a brief overview. You have a report in the packet that shares some additional information about that outreach. Again, we're really disappointed to have to bring this to you, and we've had a lot of discussions with various stakeholders and our staff, and we welcome the board's questions and comments, and I want to ask the presiding judge and the sheriff and the DA if they have any additional comments they'd like to make.
This is Deb Vogt. Can you hear me? Okay,
Yes.
good. Great. So I just wanted to make a couple of comments, because I think for a lot of us who've worked really hard on this project, this is a disappointing day that we have to make this decision. But although it's a disappointing day, it's the right thing to do. I feel strongly that it's the right thing to do. I'm working in a courthouse that it's been eye-opening with the state of the world and the unprecedented situation that we're in. It's eye-opening about what is really needed for the future of justice in Lane County. I think the need is great, and this has shown us that the situation is really worse than ever. But frankly, as Steve has mentioned, Mr. Mokrzycki, our community really has other health and financial concerns that are at the forefront for all of us, and that will be for the foreseeable future. And frankly, as leaders in our community, we need to focus on those immediate concerns of the people in our community. And because we have such a tradition of fiscal responsibility, that's what our citizens continue to deserve always. And I think to go forward at this stage with a 2020 measure would not be responsible of us at this point, despite the need and the continuing need. We have had to cut back just everything in the courthouse. We're doing everything remotely right now. We're really only dealing with civil matters that are motions by telephone, and in custody criminal matters by remote means. Today, for the very first time since mid-March, when we went into level 3 restrictions, today I will have out of custody remote hearings for the first time to add back to try to take care of some backlog, and we're going to continue to add back. At noon, I have a meeting with the Chief Justice and the other presiding judges in the state regarding restrictions and how they might be lifted. And as I continue to work with those folks to try to figure out how all of our community partners can get into court and get their disputes heard and cases handled, I'm continually set back by the fact that we're hampered by this building. You know, I have to get jury trials going again, and because of the way the building is structured and elevators and everything else, I'm going to have to probably take 3 courtrooms and jury assembly just to get one jury trial going the first week of June, which is my goal, the first week of June. So we are also, once again, and this is normal, you've heard this for years now, in another week and a half, I think on the 18th, our transport elevator goes down again for the inevitable machine shop work that'll be down for a couple of weeks, hopefully before we have to start transporting in custody defendants for jury trials. So I just wanted the message to be, I'm no less enthusiastic than I have been. In fact, I'm more enthusiastic than I have been in the past about the need for the courthouse. But I totally agree with the decision to recommend that we not go forward with the bond this year.
Chair Buck and Commissioner Sheriff Cliff Harold here, and I'll just add on to what Judge Vogt shared with you. All 3 of the elevators in the courthouse are going to go down in May. We're going to stage them, but all 3 of them have to once again have their motors rebuilt because there's no replacement for these old parts. And so this will be the second time we've had these motors rebuilt. We are going to take advantage of a decrease in use during the month of May to try and get that work done. So as the judge shared, of course, we are still completely convinced that the courthouse needs to be replaced, but also agree that given the state that, frankly, our globe is in, but particularly our community is in, it doesn't make sense to move forward at this time.
DA Perlow, are you on the line? Would you like to say anything?
I am, Chair Buck. I can't articulate any better than Judge Vogt and Sheriff Harold have, that the need still exists, and it would be unfortunate to try to present this to the public at this time. And hopefully we will have an opportunity, the legislature will continue to recognize the need that we have, which has just been demonstrated even greater during this crisis that we're in right now, as Judge Vogt indicated, that we will have an opportunity to go back to the voters when our economy is in a better state and things are better settled and people are feeling confident.
Commissioner Farr.
Thank you, Chair Buck. I agree with the presiding judge. This is a disappointing day indeed. You know, we've heard from some of the most interested parties about how the need for the courthouse is greater than ever. But it's becoming more and more evident as we move through the crisis that we're in right now that we need a different facility. But Mr. Mokrzycki, it sounds as though you would like us, the Board of Commissioners, to provide direction to pause planning for November 2020 bond proposal and work with the state partners to identify options regarding the state matching fund for reconsidering at a later date. I know that to be the case because I'm reading your words. So is that a good characterization?
That's what we're recommending, and that's the direction that we're looking for from the board. Yes.
Then I would agree with that direction. Thank you.
Commissioner Sorensen.
Thank you very much. Thank you very much to Judge Vogt and Sheriff Harold and DA Perlow for your great work on this. And I guess I would say I'm sorry about this decision, but certainly understand it, understand your recommendation. One thing that I've been thinking about for the future is if the country does see the need for putting people back to work in a major way, we could see something like the Works Progress Administration and assistance to states and local governments by the federal government in putting people back to work. And I would like to make sure that our project is as shovel ready as possible in the event that our legislative delegation, by means of a appropriations rider or just a general turnaround in assistance to the local governments and states, if there was a policy change in Washington, D.C., to do that, that we might see funding for capital projects that are, quote, shovel ready, or at least ready to go by some as yet as currently non-existent federal standards for receipt of those funds. But I really see our courthouse as an example of a project that really should be built. Obviously, the local voters probably would not approve it. The local voters probably wouldn't have the financial capacity to pay for it under the current awful conditions, economic conditions. So I just wanted to say that the efforts by Mr. Penwell and Mr. Rickoff and others within the county government ought to continue, because if we are asked at some moment, do we have any projects, I think we ought to be able to answer, yes, we do. And so that's just a parting thought. And one other point, and I think it's an important one, because we've got two commissioners currently on the board who had this experience where toward the very beginning of their term of office, the Justice Center came up right away. And I think that since I'm leaving the board later this year or early next year, that my successor will need to be briefed, and at least on behalf of the county staff, I'd just like to remind Mr. Rickoff and Mr. Penwell, Ms. Ashbridge, at a minimum, to watch the election for the South Eugene Commissioner position carefully, so that a briefing can occur as soon as the clerk's office certifies a person that wins the seat. So right away they can be brought up to speed. This could happen quickly. I hope it happens quickly in 2021. And obviously our legislative work will have to continue to get an extension on what the guarantee or the match of state funding. And thanks very much to all of you for your service on this issue.
Commissioner Berney.
Judge Vogt, Sheriff Harold, DA Perla, thank you very much. It was my baptism into this office to work with you in trying to advance and advocate this particular initiative with, I hasten to add, Commissioner Bozovich. It was a fascinating first few months. I am not disappointed by this day for this reason. I believe this is the only prudent, responsible decision to make, and therefore we need to make it, which is to push it off, because what I'm disappointed with today is we don't have a plan for schools to reopen in the fall at the latest. We don't have a plan for businesses to reopen as soon as possible. Mental health, indices of suicide, domestic and sexual violence, and other things are on the increase. That's why I am upset today. I think I would be equally upset if we didn't take a deep breath, a swallow, and say this is absolutely not the time to advance this ballot initiative. And at the same time, it is needed more than ever, period. So that's how I feel. I'm looking forward to resurrecting it as we can. Of course, Commissioner Sorensen, this staff has already indicated to me they are going to be aggressive to identify other sources of funds. Wouldn't it be great if we could amalgam a federal and state and response in such a way that we have to ask Lane County taxpayers for little, if anything, in order to move this forward? I think that's our desire. Of course, we need to work diligently to hope that the state match can continue. But I think it's the only mature and fiscally responsible choice this board can make at this time. That's my opinion. I did have a question. My understanding is that extension services deferred putting an initiative on the ballot out of respect to the county and us anticipating putting the prevention center initiative on the ballot. And now might we find ourselves in another position in May of 20, I mean, is that not conceivable? Where both of these again might be advanced by the county. And if that's the case, I would hope we would communicate to them that we support their putting their initiative on the ballot at the timing of their choice. And if they want to move that up, that's fine with us. Those are my comments. Thank you very much.
Mr. Bozovich.
Thank you. You know, one of the things, you know, as an engineer, the first thing they did was put me on facilities committee. And I've been on that ever since as a commissioner during my 2+ terms here as a commissioner. And I've started advocating for replacement of the courthouse in early 2012 after, you know, getting a tour of it from the then presiding judge, Bearden. So even one more ahead of Mr. Mokohysky there. And I've been an active supporter of this project for a long time, and I still think it's a very necessary project. And the COVID-19 outbreak actually even highlights even more how inadequate this facility is. I mean, I've had regular meetings in some of the jury deliberation rooms for the court security task force. I can't imagine being in there with a bunch of people that are from all over the county randomly selected and then going through the jury selection process. So you have no idea how well they've been social distancing or whatever. And this room is literally shoulder to shoulder and almost face to face across the table for a jury. It's just an insufficiently sized room. So it's going to be difficult, I think, for Judge Vogt to move on with jury trials and figure out how they're going to do jury deliberation. They may have to use a empty courtroom to seat the jury far enough apart to make them feel comfortable. So it's going to be a fascinating issue for the court to operate post-COVID. But even without COVID-19, I would have made this recommendation to postpone this vote. And that's based on the fact that this commission has gone back on their push to get the federal government to uphold their funding through their federal forest payments through the Association of ONC Counties. We've withdrawn our membership there. Without that membership and without pushing for that revenue, there are people that would have run a no campaign against this, because we're now turning to local revenues to replace federal revenues. And I just don't see that we would ever have gotten a yes vote. And when you look at the polling data, where there's such a incongruity between what the public thinks that building is adequate versus what the real truth of that building is, we needed to have a very aggressive yes campaign to educate the voters. And with a no campaign pouring sand in the other ear, we'd have never turned this around to a positive yes vote. So I would have been in February at this point, unless we rejoin the Association of ONC Counties and start fighting for our share of that federal revenue and getting our federal forests working for us, particularly as we try and reopen the state. Talk about an occupation where you can social distance. Cutting timber is pretty well social distancing. So I would hope that this board will strongly consider during our budget process rejoining AOCC, and therefore putting us in a position to get to yes sometime in 2021 or whenever the economy recovers enough that we can ask the voters again about this. But I would have recommended this action even without COVID-19, because we were going to run into a no.
Okay, well, with that, I'll only add the fact that I am concerned that it will take some kind of injury or some kind of tragic event for us to be able to, as a community, build a new building. We desperately need it. I think all of us on the board have expressed that in one way or the other. However, we all acknowledge now is not the right time to pursue it, but it does need to be done and need to be done a long time ago. So I hope that we can get back to it as soon as we are all getting back to business in our community and know that our community is safe and we can move forward with it, because we desperately need a new building soon. So for this item, do you, Mr. Mokrzycki, have what you need to move forward?
I think so. I don't, we're not necessarily looking for a motion from the board. It's just direction. And what I'm hearing as direction from the board is that we will not move forward with a ballot measure for November of 2020 related to a Justice Center bond. We will continue to work with the state legislature to continue to seek the state funding necessary. We will aggressively pursue other forms of federal and state funding to help lower the local cost. But for now, we will not pursue a ballot measure for the remainder of this year.
Okay, thank you, everybody, on this particular item. Since we're running short on time and we have the sheriff with us, I'm going to go back to item 7A, Order 20-05-05-02, in the matter of awarding a contract to Daniels Electronics Ltd, DBA Code and Radio Communications, in the amount of $526,179.79 for upgrades to the Sheriff's Office conventional radio infrastructure and delegating authority to the county administrator to execute the contract. And with us, we have, hopefully we still have on the line, Sheriff Harold.
Thank you, Chair Buck and Commissioners. I'm going to make my presentation pretty short, but will of course be available for any questions that you all might have. I do want to provide you with a clarifying remark. We're talking about the radio network that the Sheriff's Office maintains, which is different than what you sometimes see related to LRIG, the Lane Regional Interoperability Group. So LRIG is a group of partners, Eugene, Springfield, far and wide, and the LRIG radio connectivity is fantastic, and it's very good for our organization in the metro area. But being the county, we oftentimes have to send folks out into the farther reaches, and the LRIG radio coverage does not cover us there. This is why the Sheriff's Office has to maintain a separate radio network with repeater towers on an older system so that we can maintain communication with our units when we have to send them, for example, way up Round River Road or Oak Ridge or any of the more difficult pieces of terrain in Lane County. So we do maintain that separate network outside of the LRIG. Of course, you oftentimes see financial matters related to LRIG because we, the Sheriff's Office, are also the fiduciary for LRIG. So that's why I'm trying to clarify that this is separate from those other expenses that you sometimes see. This is the Lane County Sheriff's Network. By most engineer recommendations, we're 6 to 9 years beyond overdue for this upgrade, but we have a lot of deferred maintenance on our system just because of the budgetary issues, of course, throughout the years. We do maintain a fund for our communications network, and we have scheduled to do this work. And again, even though it's been deferred, we were planning on doing it in 2023 because we thought that's when we would have the funds available. However, because of going early on some of the other work that was needed and saving some money, we're in a position to do this work this year instead. By doing it this year, two things I'll point out. Traditionally, we work a lot with Motorola and Motorola products. I do have Brian Gregg available to you for questions. He's our communications network coordinator. He's done some work to verify that Codan has a good, viable product. and was able to get a quote that's about $146,000 less than the Motorola quote to get this needed work done. And we're additionally anticipating about $136,000 savings by doing it this year instead of delaying it. So I know that's just a super high level overview, but I'm going to conserve some time and just see what kind of questions the commissioners have and whether I'm able to answer them or if we want to bring the radio guy in.
Any questions from commissioners? Commissioner Farr.
Thank you, Chair Buck. Not a question, but just I guess it is a question. Sheriff Harold, option 1 is to direct you and or the administrator to order contractor Codan because the quote expires on May 27, so we need to do that immediately. Is that a correct assumption, Sheriff?
Yes, we're all set to contact them with the board's authorization.
Then, Chair Buck, I would move option 1 to award the contract to Codan and whatever associated board order needs to be generated from that.
Okay, we have a motion to approve board order 20-05-05-02. Is there a second?
Second.
Seconded by Commissioner Burney. Any discussion? Commissioner Burney.
This isn't a life or death question, but I'm just curious. I don't know who Codan is, and I absolutely rely on the sheriff's judgment and county administrator's judgment. But is this will this purchase benefit any local employees or local business?
Chair Buck and Commissioner Burney, I have to be honest with you, I don't know the answer, but it could be either Lieutenant Larry Brown or Brian Gregg. I think they're both available. If either of you have a response to that, go ahead.
Go ahead, Brian. This is Brian. Can you hear me okay?
Yes, we can.
As far as local businesses, we work closely with a vendor who has helped us with this quote. So that would be within the state and locally, their local rep here that would keep some of the financial resources for their efforts that they've been doing here with us to build this quote. As for the manufacturer, they are a Canadian-based company, but they provide services far and wide to the federal government, such as the Federal Forest Service, BLM, and other varied services with that. That's where I kind of did some of my research to make sure that this was a viable product against other major manufacturers.
Thank you.
Any other questions? All right, we'll move to a vote. All those in favor, please say aye.
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 All those opposed, say nay. Motion passes unanimously. I'm going to move to item 8A. County Council is unavailable. Has very limited time in the afternoons, and there are some announcements you would like to share.
Thank you, Chair Buck. Yes. The first is, I think it's a carryover from last week, and that was some clarification on the redistricting options that I've been presented I presented to the board in terms of the work sessions and some material that I sent out a week ago, Friday, I believe. And then the second issue is the one that has been raised by Commissioner Sorensen, and that's and I know you and I have exchanged an email on this too, Commissioner Buck, and that is the participation of the board in this phone call with the governor. So you tell me which one you'd like to address first.
Let's do the phone call. I think that might be a little shorter.
Okay. Well, I sent the board an email, and I can't remember whether it was yesterday or Friday. I don't remember exactly, but it was about a webinar that was being offered by the League of Women Voters. And essentially, this specific phone call has been a topic of conversation among county councils. I will say many county councils did not know that a quorum of their board was participating in this phone call. And my only concern is the one that I always have when we have a quorum together and communicate, the risk of certainly and usually serial meeting. Hopefully you're hearing from the governor about things you fighting on in the future, opening back up Lane County. And, someone could say, that, well, here's this, one of our committees agree, I think that's great. And another one says, I agree. Third one says, that's great. Now we have a quorum. So recommendation, whenever it's like this, is put it to two people, can report back to the board. But if all the commissioners, they need to be of that rule, and remember, the voters are entitled to know the basis of your decisions. So just like with the legal voters, if you win, my recommendation is that you disclose.
Cutting out on us a little bit. Mr. Dean, cutting out just a little bit.
Oh, I'm sorry. And just like the webinar, if everyone does choose to go, that they declare at a public meeting that they participated in this phone conversation, part of the information they learned during that conversation, into their decision. And with that webinar, there is no record. There's no record being created, which is what my one recommendation is. It's to commissioners. That's all I have.
Okay, on the governor's call at 4 o'clock, you're recommending that just two of us attend. So we need to choose the two that should be on the call. Commissioner Sorensen.
I think that we should have the board chair and vice chair.
Anybody else have any comments on this particular item? Commissioner Bosovich.
Yeah, if the board chair and vice chair aren't able to attend, I'd be happy to attend. Been following this pretty closely.
Okay. I'm happy to attend. I will be available all day.
I feel bad because I'm happy and want to attend also, but I wish there was a way for Jay to join us. Okay. I'll be there. I'm sorry, Jay, go ahead.
Yeah, no, that's fine. I'm glad you're going to be, and that kind of makes some sense to be chair and the vice chair. I'll be interested to hear your report. I am submitting some questions to him in writing, not copying anybody else. So you may hear some of my questions get answered.
How will I know that they're your questions?
Okay, so it sounds like chair and vice chair will be on the 4 o'clock, and we can, at the next meeting, perhaps give some notes back to the board. Commissioner Sorensen.
I was wondering if you and Commissioner Burney would be willing to just send us, or maybe next week, distribute to the board as part of the board meeting packet, just your sort of notes that you make sort of moment to moment as the meeting is going on, so we can get a flavor of the phone call of who said what. Is it possible to make a transcript of it, or get some kind of some of these services allow you to get transcripts, and if we got the transcript, that would really give us a flavor for what happens, because I tend to think there's going to be a big row, a big fight really over the let's say public health oriented policy that the governor is advancing, as opposed to the what I'll call the protester perspective, that we should accept a certain level of deaths, kind of perspective. Is there a way to do that and still be within the rules of the public meeting law?
Well, it's a Zoom meeting. I don't know that it's recorded, and I do believe that might be up to the governor's office, and we don't have that information right now. I believe we can ask after the fact if there's a record and share that. If not, I'm happy to, with Commissioner Bernie's assistance, to report back to the board. All right, with that, Commissioner Bernie.
I just wanted to thank Commissioner Sorensen for first suggesting the chair and vice chair go and then telling us how to report back. I assure you that that with the chair, if there's anything urgent or time sensitive, obviously we are duty bound to share that with commissioners, certainly before the next meeting. And that would not occur from us to you. That would occur probably from us to Mr. Mokrahysky, who will take it from there. So I wouldn't be too concerned. Thank you.
All right, County Council had one other issue for us, which was, well, at last meeting I mentioned that Mr. Dingle put out a email to us with some options regarding redistricting. And we're gonna all read that, brush up on it, and come back with some direction for him. Has everybody had a chance to read it? I have. I'm not seeing a no. So he laid out 4 different options with pretty detailed information on the varying options. Given our time constraints, personally, I am interested in option 3, which is to proceed with an option as an ordinance. And then if everything works out the way that we intended, to propose a charter amendment in 2022. I'm very interested in what everybody else thinks. Anybody interested in commenting? Commissioner Bozievich.
Thank you. And I don't have the memo right in front of me, so I can't remember which option it is, but I am strongly interested in moving forward with a charter amendment in 2020 in the fall election. I believe we still have time. I believe we just took a major effort off of the plate of staff in our action before last in pulling the courthouse. And I think we've got time, and as things are slowly opening up, the ability to get some public input, particularly if we start with the template of that proposed rework of the League of Women Voters initiative as a guide rather than starting from scratch. Because if we don't amend the charter, we're not changing anything. We pass an ordinance that says we're going to do it through a committee. It's still in our charter that we, the Board of Commissioners, have to adopt the districts by ordinance. We can't delegate that authority that's given to us under the charter. We have to amend the charter to do that, to make it stick and truly have an independent citizen committee do the redistricting and take this out of the hands of elected officials picking their own voters. Because we've actually had committees before in every past version of redistricting. There's been committees formed in various formats, and ultimately the boards overruled the committees and adopted their own versions. Whether it was a progressive majority, a conservative majority, didn't matter. So going through the ordinance process is not changing anything significantly. And unless we go through a charter amendment, we are not actually changing the process. And I think what we're hearing through some of the email traffic we're getting for what the League of Women Voters has been telling us is they want us to change the charter and make this so that there is a true citizens committee doing the redistricting. So there's a much more fair process and open process of how redistricting happens. So I'm in support of the option of moving forward with a charter amendment this year.
So that is option number 1 outlined in the email. Anybody else have any comments, opinions? Commissioner Sorensen? You're on mute, Sorensen.
You mentioned that the options that you're referring to are in a memo or in an email? I'm trying to look at our agenda today to see what we're talking about. What are we talking about? Where is it on our agenda?
On last week's.
It is an email sent by Mr. Dingle on 4/24. And I also didn't see them attached to the memo or attached to the material for today. And we can ask for that to be attached. But it was sent out to all commissioners on 4/24.
Well, I would.
It was attached last week.
Okay. So I'm just asking first, where on our agenda is this action that is being proposed?
This normally would be in the area where we are updating our board assignment request, because it was a previous board assignment request, but we do have county counsel with us right now. He is unavailable at certain times in the afternoon, so we brought up
It
this.
sounds like what you're saying is that we're under 8A, county council announcements, and that we are hearing the announcement about the governor meeting, and that's been done. And now we're hearing an announcement about whether to respond or not to the county council about whether we are going ahead with some sort of change in either the charter of Lane County or an ordinance of Lane County. I'm just trying to figure out what is our agenda item, because I don't think the public has had any indication whatsoever that the Board of Commissioners was going to discuss making a charter amendment or making a ordinance or even giving direction on it today at this meeting. So, and what was the date of the memo that you're referring to? It's an email from Mr. Dingle to the Board of Commissioners?
Correct. Chair.
Okay, what was the date of that?
I believe Rebecca said it was the 24th. A couple of attached. This was brought up last week. It was said you viewed the
County Council, Steve, you are going in and out, so we can't hear your full sentences.
Sorry. Make it clear to commissioners, this was noticed. Was continued.
You cut out again.
Oh, sorry. It was continued because I had an opportunity to.
If I could help, seeing Mr. Dingle's cutting in and out. Last week, this was on our agenda. And prior to that, the meeting, Mr. Dingle sent a memo to all the commissioners asking us to review it prior to the meeting so we would be prepared to discuss it. When we got in the meeting, Commissioner Sorensen, you stated that you hadn't read the memo yet. So we continued this item to this week to give direction, because direction was unclear about what county council was assignment was around redistricting. And you were going to read the memo between last week's session and this week's. So this is a continuance of a previous noticed agenda item from last week to provide clarification of direction around redistricting, because in our previous meeting around redistricting, we gave very unclear direction. So that's what we're seeking, is that clarification of direction. And you specifically said you were going to read the memo between last meeting and this one.
Yes, thank you. And now I have reminded myself that I have read the memo, and I looked at it again, and thanks for the information. I would say I agree with our chair. I agree that we should continue the discussion of this, particularly using the option of improving the ordinance by which we implement the charter. I do not believe it is appropriate this year to seek a charter amendment for several reasons. One, the Lane County Charter Review Commission did not recommend any such charter change. Number two, we're in at least one, if not two, emergencies the board has declared, one for homelessness and one for COVID-19. Those emergencies, in my view, still continue. and we should be careful. I don't think it should bar us, but we should be careful about making changes to the operating charter of Lane County in a setting where the ability of people to understand what we're doing and why we're doing it is important, and we have a hard time doing that during the emergencies that we're in. And last but not least, I think it's worth discussing the league's proposal in as much as their proposal could be adopted in the context of a county ordinance, and we could test it. We could determine whether or not it was an improvement or not over the systems that have been used in the last 3 redistrictings that I personally have participated in.
Commissioner Farr.
Thank you, Chair Buck, for all of the pros outlined in the memo. I'm in favor of the charter amendment approach myself. In particular, that it could not be changed by later boards other than by a charter amendment. So I think if you read the pros and cons, if anybody reads the pros and cons, it really does make a great deal of sense to go through the public process that is required for a charter amendment, allowing the regular public input at this point in time. In that we have removed other things from our agenda for this summer that gives us time to do it and time to have a robust public discussion surrounding it. So option 1 is the one I prefer to go with, which is a charter amendment.
Okay, we have 2 that are interested in option 1 and 2 that are interested in option 3. Commissioner Bernie.
If these are my 3 options, I'm going with 3. But let me explain. We just got through a process of saying this wasn't the right time to put a ballot initiative for a courthouse, a courthouse in November. I'm gonna choose whatever, which I think we agree on, whatever enables as many groups, citizens to input this process as possible, without giving up the responsibility given us by the fact that we've each gone through grueling elections. Well, at least most of us. You can't tell who I'm looking at. And this is a part of the process. I also am not convinced a charter amendment isn't something we could deal with without having to say we have to do it in a hurry by November. Okay, Jay, forgive me. I just fail to see. I find it fascinating. 2 of the 3 commissioners who were here, well, actually, Pat, I don't think you were here during the last one as a county commissioner, forgive me. So we have 2 county commissioners, each of them.
The city last time.
Thank you, Pat, I'm sorry. We have 2 county commissioners that have gone through this process, both disagreeing with one another. And yet, from what I understand, one of those commissioners will provide a lot of intellectual leadership to the results that finally occurred, which is Commissioner Bosevich. And I understand that at that time, that was a role, and forgive me if I'm wrong, Jay, you can clarify because I don't know, but a role that you fully participated in. And then I also am hearing from Commissioner Sorensen that has been involved 3 times. I don't know if it's been a politicized process or no. On the one hand, I want to get it out of the realm of politics and more into the realm of people. Obviously, I am against anything where politicians attempt to sway how districts will vote. I think the 2 relatively new commissioners on this board have demonstrated, even were that the case, anyone can win. And so at this moment, based on the information I have, if I had to vote right now, I would vote for option 3. Forgive my long-windedness.
Commissioner Bosevich and then Commissioner Farr.
Thank you. So one of the reasons why I want to move forward is charter amendments can only happen in even years in May or November elections, unless we make some other changes to change that. And we will be doing redistricting sometime probably in late 2021. There may be some delay, but it's not going to be far enough into 2022 to be able to run a charter amendment in 2022 that's going to be effective for this round of redistricting. What we've seen consistently is a process that we assign a committee, they go out and do and present options and make a recommendation to the board. And 20 years ago, the board chose their own option that they presented at the last minute and adopted, that was worked out at that time before a lot of public meetings laws between a group of commissioners that got the East Lane County Commissioners support the vote by cutting out as much urban area from that district as possible, which caused the East Lane County District to go west of Walton in order to get enough population to balance the population, but not have a lot of Eugene Springfield in the district. That's the sort of monkeying around that happened. In the case 10 years ago, a very strong personality on the committee convinced fellow committee members that it would save money if they just kept those gerrymandered districts. And the board ended up having to overrule that to adopt a set of districts that actually applied the Secretary of State's recommendations about what a district should look like. But even with that, that was seen as gerrymandering also. So that without changing the fact that the board is the last say, we will always have that temptation to jump in and change whatever recommendation a committee has. So if you're not supporting moving forward with a charter amendment, which we have plenty of time to get done, requires public hearings, and then is going to require a public vote and discussion. And the reason we put off the bond measure was that's a financial issue. And putting a financial issue forward after the economic earthquake we've had due to COVID-19 makes sense not put on there. Putting a good government and good governance order forward in this time is actually makes perfect sense to take, to do something that doesn't have a financial impact or very little financial impact. And if you don't support that, basically what you're saying is I want to reserve the right to overrule the committee. And you're looking to be able to serve yourself. And whatever you recommend today, that's what I'm going to move forward with. I'm seeing two commissioners that are willing to give up the power to have an independent commission do redistricting to make it fair, impartial, and not have elected officials picking their voters. And I'm hoping maybe we can get a third to support that and move this forward. If we don't move forward this year, we're not doing anything for the next redistricting. You're basically saying, I want to be in control and have the last say and be able to pick my own voters.
I just want to take a moment to speak in here for a moment, then we'll get Commissioner Farr and everybody back in the queue. I think option 3 does also move us towards a charter amendment. I know we disagree on that. One of the issues I think we had with putting a prior issue on the ballot is we didn't have enough robust conversation with our community about what we're doing. I think it's extremely important that we do that the next time we put something on the ballot. This particular option provides us time to have community input. In last meeting, Commissioner Farr had expressed how the process had occurred in Eugene, and maybe you don't need something quite as lengthy, but that seemed to be a very intriguing process. It's not just that we put something together as soon as possible to get out there. It's really important that our community knows what they're voting for, and we've thoroughly vetted it for people. I reject the idea that just because we want to move with one of these other options, that it means that we're not interested in putting something permanent together for our community. Option 3 actually specifically says we would move to a charter amendment. And that gives us an opportunity to engage our community in a much more robust manner, and potentially in person again when we can get out of this pandemic. So I wanted to put that out there. Commissioner Farr, you were next.
Thank you, Chair Buck. You know, I've been involved in 2 redistricting, both with the city, and neither was ever accused of being political. I've been a part of 2 redistrictings that were over and over again accused of being political. The first one was which created my House District 14, which was very political, and it provided districts which I've outlined a number of times, that had the people of Cheshire and the people at 6th and Chambers in the same district, had the people in Shed and the people in at the University of Oregon in the same district, very political. And everybody accuses it of being political. Everybody knows that it was. A lot of accusations about the last 2 county commission districts, which have affected me, not directly, but subsequently did affect me, of being accused of being very political. By going forward with ordinances allowing future boards to change and to adopt their own rules, simply based on ordinance as opposed to charter amendment, opens the gate to politicization of the process. And Commissioner Burney, you said you don't want to see a politicalized process. Well, we've seen it, and that's a charter amendment. This year being an even year would give us an opportunity to move forward directly with it. Having taken the financial issue off the ballot for November, it does give us time to engage in a public process that could be very robust. We could get a great deal of input. So by doing this, by moving forward with it as a charter amendment, then we're going to depoliticize it forever, in effect. And you know, how many times during meetings do we have somebody step forward and say, due to the gerrymandering, so-and-so is my county commissioner? Well, you know, I have no opinion on the gerrymandering other than the last redistricting put Glenwood in Springfield and Ferry Street Bridge in Eugene. That doesn't seem gerrymandering. That seems like it should be just a normalization of balance. And that's what a citizen committee would be able to do, would be to look at the districts and without political input, without political agenda, present whatever redistricting needs to occur. And redistricting really should be minor adjustments. It should never have to be a major adjustment once the big lift has been accomplished, which is what the city council did back in after 2000. It made the big lift then, and then after that it was minor adjustments. Now, if you look at what we have in the state, we have a major adjustment that needs to be done. It's a horribly gerrymandered system for the state, for the House of Representatives. So we need to avoid that at the county level as much as possible. And I believe that the charter amendment is the way that we do it. So I hope we get a 3rd vote to move forward with that or delay the discussion on it.
Commissioner Burney.
You all should know how much I hate to admit that one of Commissioner Bozovich's arguments resonated with me, but you're right about the financial. You're correct about that. Does pursuing option 3 preclude going through a robust process and ending up moving forward on a charter amendment? That's my question.
I don't know who that, Chair Buck, Commissioner Burney, I don't know who that's directed to, but no, the process can be as robust as you want.
Thank you, Mr. Daigle, because guess what? I did not know who I was asking that of either. But I think all of us share the same intent. For me, I like to keep options open and get more information and more input before honing in on one or another. So for me, if option 3 can lead to us taking a direction which would include, not preclude, a charter amendment, I fail to understand why we wouldn't unanimously move in that direction, if that's the case.
Commissioner Posevich?
Yeah, so to answer your question, Commissioner Burney, or Vice Chair, option 3 precludes a charter amendment prior to doing the redistricting. So what if you vote for option or give the head nod to option 3 and provide direction to go option 3, you're basically saying, I want to keep the cronyism involved in the current system of us picking our own voters, because that's what ultimately we'll do for 2021 in our required, under our charter. We have to do it next year because it's been 10 years. We have to redistrict every 10 years. And yes, maybe we'll get to a charter amendment in 2022, but then there's no, then it'll be probably 2031 before that charter amendment ever gets used. So basically you're saying, if you go option 3, you're basically saying, I'm okay with the current system that can be involved a lot of cronyism, and I'm good for that for the next 10 years. So option 1 provides us a change for this process for this decade, and assures that it'll be in place for this decade. And it is Cinco de Mayo. Decisions for this and ultimately placing on the ballot happen in late July, and some of the other deadlines are in August. That's over 2 months to have this conversation with the public and get the public's input. Not to mention then once we actually, if we move forward and put something on the ballot for November, there's going to be a significant public discussion while it's on the ballot. So I'm not afraid of the timeline. I'm not afraid that we won't get enough public input. What I am afraid of is keeping this current system, where, basically it's a crony version of how to, elected officials picking their own voters in place for something that happens once every 10 years. And I've been advocating for this since last fall. I mentioned it when we had some of our first meetings about redistricting, and some of the commissioners have kept pushing this decision back to where it is gotten to be really pushing the deadline in some ways. But every time this has come up, I've talked about doing a charter amendment. And we are now at the we either do it or we don't do it. And going to an ordinance right now just means it's not that we're punting past the 10-year process. And yeah, great, we might get a charter amendment in 2022, but it's going to be used for the 2031 redistricting. So if you're okay with leaving the crony system in place for this particular decade, then go for option 3.
Okay. We've got...
It sounded like a campaign posture there, Jay. If you're okay with this.
I think some of the language used to describe what we're trying to do here is pretty divisive, when it's actually something I think most of us really want to move forward with. I originally brought this up for many of the reasons that Commissioner Posevich outlined. We don't have a lot of language about this, but I feel extremely strongly that we need to have community involvement, and I don't feel like under a pandemic we have the ability to do that, but I also feel strongly that we need to get to a charter amendment as well. So it seems like, Commissioner Burney, you may be the one to finalize the direction in which we go if we are to do that today.
If we are to do that today, I started all of my rambling with that I would lean towards option 3.
Okay, so it seems like we have 2 that were interested in charter and 3 that were interested in option 3. So we have 3 head nods to move in the direction of option 3 at this time. Again, if that changes, we'll need to know pretty soon. County Council, do you have anything remaining?
Chair Buck, I just want to make sure that that there was none of the commissioners had any disagreement with my proposed outline for the work sessions and obtaining public input. That was also included in the memo.
I'm okay with that. Anybody else have any comments? Mr. Bernie?
Would you mind? I'm sorry. I printed your email off because I did not see it in our board packet. Our board packet, I can make it large enough for my bad eyes. Could you review, Mr. Dingle, that? Because again, despite this vote that was just cast, I'm trying to understand why we can't begin this process with plenty of time, again, to put that charter in place. So would you please review, if the board wouldn't mind, what your suggested path forward was?
Well, the path forward would have been dictated by whatever the board decided to do, because again, the one for a charter amendment this year, which is required by our code, excuse me, would be on a much shorter timeline. Essentially, the outreach was the same. It was just how quickly those two things would happen. And I know that the board has a lot going on right now with the pandemic. You're also in the middle of budget season, so I know you have, like today, a committee meeting after this. But basically, what I was proposing was that we would schedule two work sessions, that we would notice all of the major political parties, the League of Women Voters, a variety of people. I did ask for additional direction on what the minor parties were that that Commissioner Sorensen mentioned, and that we would invite them to submit in writing or in person what they think the process should look like, and then after that first work session, perhaps refine it. I've also been keeping a list of individuals who've emailed me about this that I would also send that notice to, and we would notice it, of course, as a public meeting. I would ask the chair to maybe mention it in announcements or something at those previous meetings to cast as wide a net as possible. But essentially, that would be it. We'd start with a minimum of two work sessions that included the very open solicitation of information from the public. I will say I do agree with Commissioner Bozovich. I do think that it helps to have something for people to comment on. I know that Commissioner Sorensen just wanted to start from zero. I think it would be a much more productive work session. Well, here's what I fear. Someone's going to come in and say, we should have an independent commission pick the commissioners. And then again, it's like, what does that mean? So anyway, that's what's outlined in my memo in terms of what I would do. And then after assuming after two work sessions, we would either be drafting, I guess with what's happened here, an ordinance, that the board would begin directing staff in the process to draft an ordinance based on what they picked from or gleaned from the public comment of the two work sessions.
And why could that not occur within a time frame so that if a charter amendment was desired, there would still be time to put it on a November ballot?
I'm sorry, Commissioner Bernie, it could. It could.
Well,
it would just be very, what I was saying is that it will mean, you're talking about typically work sessions are done on a Wednesday. The real crunch date would be July 3rd, 2020. So you'd have to do it you've still got, 2 full months to do that. I was just commenting that you have a lot of other meetings besides your regular board meetings. That's all. Certainly doable, certainly doable.
Commissioner Sorensen?
Yeah, I just wanted to answer one aspect of Mr. Dingle's request. He wanted to know about the difference between a major political party and a minor political party. And I don't think for purposes of this discussion, we need to particularly identify them, but I would just say I have a list of them in front of me, and they're pretty short. The major political parties are the Democratic and Republican parties. The minor political parties that I believe is accurate to summarize would be the Independent Party, the Constitution Party, the Working Families Party, the Green Party, the Libertarian Party, and the Peace Party. And I believe that covers my definition of major and minor. Ms. Betchard, if she has a list of political parties that are in Lane County, the ones I gave are Oregon political parties, so they may not have all of them in Lane County, or there might be a Lane County. But I would just say my idea was to, invite as many of the political parties as possible to give their perspectives, both on what we're doing as well as how we should do it. I do agree with the concept, Mr. Tingle, that you made, which is that it'd be nice to be able to tell people what we're trying to do. And I would just say we are trying to improve the process by which the county districts, the 5 commissioners and the commissioners' constituents, the constituencies of the 5 constituencies in the county, and do people have an idea for improvement, and how to structure a process of gaining a better improvement. So I think that kind of summarizes my view. And I do think that it is hard to do that in May and June, but especially May because of the budget. But I do think we ought to move on this when we have time, and that looks to me more like June than May. Thank you.
Did you include non-affiliated voters like myself in that, Commissioner Sorensen?
I would include a way to contact them, but I believe that the question was, how are we going to reach out to somebody other than the Legal voters? And I think that if we had a way to contact non-affiliated voters as an organization, but my understanding is that there isn't such a thing as a non-affiliated voter group. There might be individuals that identify themselves, but in terms of trying to answer Mr. Dingle's question about, who would be involved, I'm trying to give some structure to that.
Yeah, your system would rule out a whole lot of people.
It would rule out a whole lot of organizations that don't exist, but I would certainly want to include them if we knew who they were. And I would certainly invite you, as well as anyone else, to invite other people besides political parties as a group or as groups to give their perspective. But if there are other people that we could involve, I'm certainly in favor of it, including representatives of non-affiliated voters.
Commissioner Burney. You're on mute, Commissioner Burney.
Sorry, I could not agree more with what I think was a sense of frustration from Commissioner Farr. It almost sounds like Commissioner Sorensen is talking about depoliticizing and then naming political groups as the only groups that are going to provide input. I think there are business organizations, trade associations, labor organizations, environmental group. There are multiple places where residents are. And frankly, I feel like this discussion, and I may be dead wrong, and I'm the first to admit it, is a good example of politics over substantively just trying to work through something. Why can't we create a process that invites the input, frames it the way the information would be useful, has dates by which it needs to be received, so well in advance of the July, whenever that July date is that Mr. Dingle and Commissioner Bozovich mentioned as sort of the date certain, we have enough information and enough people with provided input so we can make a decision about charter or in November or ordinance moving forward. I just don't understand why that's not possible. And I really want to get it out of just the political parties.
Commissioner Sorensen. You're on mute.
I'm sorry. Sorry for the delay there. I totally agree with Commissioner Burney. I think that we should include the political parties, and I've enunciated the answer to the question, which was which political parties, major and minor. I listed the major and minor, but that by no means means that I think that that should be the only list. And I would invite any commissioner to make suggestions on who else we should involve. And I certainly agree with the idea that we would involve chambers of commerce, unions, organizations of professionals, lawyers, doctors, accountants, engineers. We would certainly involve business organizations. I just was answering the very narrow question of, well, political parties, what do you mean major and minor? And I listed off the major and minor, but I totally agree that other people besides political parties are very definitely affected by redistricting. And that's why my original comment was in this whole discussion was, I really appreciate the League of Women Voters bringing this forward because it kicked off this discussion. But in no way do I think we should have their proposal alone and not involve lots of other people. So I agree with you, Joe, that we should make sure that this invitation goes out to lots of other people besides the League of Women Voters.
Okay, I'm going to move our agenda along because we have a couple of items. I'm sorry for skipping around, but we got behind earlier in the day. I'm going to have us end this morning with item 6A, any final COVID-19 updates from our county administrator and EOC commander. Karen Gaffney may have already needed to leave us. If you're there, if you could start us off, that would be great. And we'll end with this item for the morning, and we'll try to get to as much as we can in the afternoon.
Chair Buck, thank you very much, and commissioners. And I just have a couple announcements that I want to make sure I share with you that didn't come up earlier in the conversation with Dr. Ludke. The first is I know we've had lots of conversations several weeks ago about the release of demographic information about people who have tested positive for COVID. And it's been a significant conversation at the state level for the last couple of weeks. And my understanding is the state has now decided, given the number of positive cases, to begin releasing that information by zip code. And I think that may be coming out as soon as today. They have put some privacy protections in around that. So if there are fewer than 10 cases in a particular zip code, it will just say 1 to 9 cases in that zip code. And if it is more than 10, then or 10 or more, there'll be the specific number that's listed. So I just wanted to alert you that that information will likely be coming out from the state later today. I also wanted to let you know that our renovations at the River Avenue site are moving along apace, and we are still scheduled to be able to have that renovated facility turned over to us by the 13th. And we're working hard to plan a celebration that will be appropriate given the fact that we can't really host a mass gathering. So there's a little bit of a fine line in trying to appropriately plan that. So there'll be more information coming about that. We'll do something here in May, and then likely after things open up more, we can talk about having a broader community celebration there. And then 2 other quick things. I did promise each time we meet to give you an update on our financial tracker. And this week, our total between actual expenses and encumbered is actually very similar to what we talked about last week. We're at a total of $2,720,527 toward that $5 million delegated authority. Part of the reason that number has not gone up is in reviewing the expenses, both encumbered and actuals over the last week, there have been some that were inappropriately coded and have been credited back. So that's why the amount is about the same. And certainly our burn rate has been decreasing as we've had fewer cases. And then finally, I wanted to let you know with testing that this week we have started our testing of asymptomatic vulnerable populations. I know Dr. Ludke mentioned earlier the benefit we have of our 2 local labs being on board now and being able to designate some testing specifically for populations of concern to public health. So this week we have trained teams. We actually trained them last week, and this week we have teams in the field doing testing of people who are asymptomatic at our homeless shelters throughout the community. We were at Shelter Care yesterday. We're at the Expo Center today. We'll be continuing to work through those congregate sites this week, and also rolling out specific targeted testing in long-term care facilities and the Latinx population, because we know those are higher risk in our community. So those are, I just wanted to make sure I shared those with you before we finished our COVID conversation today. I'm happy to answer any questions.
Any comments on the update? Okay, I don't see any. So what we'll do is we'll recess for today, and we'll see everybody back here at 1:30. Remember, it's a different login to sign back in. With that, we are in recess.
Chair Buck, I'm sorry, this is Karen. Can I just ask a quick question? And item 6C that we haven't gotten to yet, what are your thoughts about covering that item? I know I haven't been invited to the afternoon meeting.
Karen, I just invited you.
Gee, thanks, Diana.
Okay, very good. We'll see you all at 1:30. We're in recess.
Thank you.